alhamdulillahi rabbil alamin arrahmanir rahim maliki yawmiddin iyyaka na'budu wa iyyaka nasta'in ihdinas siratal mustaqim siratal ladzina an'amta alaihim ghayril maghdubi alaihim waladdallin amin.
Let's acknowledge him, please. Thank you very much, Sheikh. My name is Hectoria Awekia, and I'll be co-emceeing with
Richard Salome.
Okay, thank you. And we'll have our first presentation for the morning by MNG Pharmaceuticals. MNG Pharmaceuticals, please, you have 10 minutes. Thank you very much.
The presentation up. Yes, he's doing it. So when I start,
Yes.
you are good. Good morning. My name is George Ebubuatin from MNG Pharmaceuticals. I'm a pharmacist and well, let me say a retired pharmacist from Ghana Health Service, and I'm now the business development manager for MNG Pharmaceuticals. I'm saying my president here. I'm coming to do some presentation on the chlorhexidine, and that had been recommended, for the use and managing childhood or the baby's course. So I'm here with my medical rep, Peter, in the green t-shirt. He's in Western region. So those in the Western region, if you need something, you contact him. I will start by giving you a little bit of some of our products. We have this which is anti-tetanus immunoglobulin. And we have the ATS, we have got the TT, that means tetanus toxoid, and we have got the hemoglobin. The hemoglobin is what you need is a 10-degree bite. Then you use the immunoglobulin to be able to arrest the poison. And at the same time, you have to give the TT. The TT is for active immunization. This one is, passive immunization. The TT will let the body present its own body reactions, and then the immunity is for active passive immunization, which is to attack. It contains the poison, anti-poison, and it will arrest the poison from that place. That one will infiltrate along the place has been the beating point. We have got the anti-rabies vaccine for rabies. We have got the equivalent, which is anti-rabies serum. Sorry, I think I've messed up there. That's the serum for rabies. To get a 3rd-degree bite, you have to use the serum, and then you have to use the vaccine at the same time. The vaccine will allow the body to present its own anti-rabies so that it will be able to arrest the situation. They have got the for those having kidney problems, the dialysis people. We have got amphotericin B, which for systemic infection, fungal infection. And those who are not responding to this, you have the amphotericin, which is liposomal amphotericin B, which is actually marked for the people hospitalized. Then we have our polymyxin B for gram-negative bacteria. And that one, apart from protein species, it takes care of all the gram-negative bacteria. Then we have got the almighty for we have a possible positive these then give reactions to produce these antitoxins against them. So we have the routine, we have got the ferrum S, which is iron sucrose injection for iron deficiency and anemia, because a lot of people don't think that we have the iron sucrose. We have the iron sucrose. And then before we use it, there's some sort of dilutions here and there, before we do the IV. Then we have oxytocin, which is WHO qualified oxytocin that we have. You have your mighty, a lot of you know. We have got other from bacteria drugs. We have got clindamycin, doxycycline, ciprofloxacin. Then we have got artemether lumefantrine for children. It's a dispersible one. And then we have got hyoscine. Then this is what we are going to discuss. It will be very brief and short, so that I'll be in my 10 minutes. This is our product. We have, it's called Emgidin. It's a chlorhexidine, 7.1%. And that is what have been recommended by Ghana Health Service and the Ministry of Health for us to be used to treat, to manage our cord, to break the cord. It is has got a composition of 7.1%. Total, and then we have got equivalent to 4%. The 4%, I was going to let you know that is the minimum effective concentration, for the chlorhexidine, which will not have any consequence effect on the baby. This is my outline. This recommendation was made by the Ministry of Health based on findings from the WHO in 2014 that you should use chlorhexidine in managing the cord for the babies. And they recommended the application of a chlorhexidine gel every day until the cord goes off. We've got a lot of problems, some of the facilities, because they mostly listen to the mothers rather than going by their scientific background. Some of them listen to the mothers. They say it takes a long time before the cord goes off or start that, so they use other means, especially the spirit is what they think that is better for them. But this is a new, that has come out that we should follow, and that we should make sure that every hospital goes by the protocols that have been brought by Ministry of Health and the Ghana Health Service. As I said, based on that recommendation by the WHO, the Ghana Health Service, the Ministry of Health adopted this, and then we said, it has been also added in the essential drug list, under NHIS. So I don't think that we have a problem here, and that we have to go by what is supposed to be for us. This was in 2020, that was launched in Ridge Hospital, which I was there, a lot of people were there, that we should start using the chlorhexidine and managing the cord. Why chlorhexidine gluconate 7.1%? It's very efficient, very efficacious, and it's been used. So many, it has got a broad base, spectrum base, and you have no problem with it at all. It is for both gram-positive and gram-negative for bacteria. It has got a residual effect. The residual effect is that it binds with the proteins, and the cord, and it's used little by little to make sure that there's no bacteria that can cross the barrier. So you don't need to apply it twice a day. It's only once a day. Because if you do it twice a day, that means you are overdosing the baby. And this is what the mothers have a problem. I will explain why the mothers are not trying to use it. And so that when you are there and they complain to you, you know how to counteract their ideas. And it's been tried and tested for about 40 years in developed countries. So why can't we use it as Ghanaians? It's very safe to use. It's been tested in Nepal, it has been tested in Bangladesh, it has been tested in Pakistan, and everything was okay. So let's have the key messages here. The key message is that, you have to wash your hands before and after. And you have to hand dry your hand, before you apply. You apply the chlorhexidine and use the index finger to spread it around. You should not force the cord to, come out. Even though it's left a little skin there to come off, you should not pull it off. When it starts bleeding, there's a problem. You have to keep the baby dry and clean. You do not apply any other substances like the mothers are doing. And you have to report any case of redness around the cord, swelling of the cord stump, the pus in the umbilical cord stump, and the bleeding from the stump. They have to report back to the hospital. This is an annotated diagram of the protocols. You have to wash your hands under running water, like the COVID time. Then you hand dry it, open the tube, applying the tube, use your index finger to spread, and then you wash your hands again. Now, the problem is what sort of quantity of the Hecorazine should you put on the cord? That is where the problem is. The women, when you give the tube to them, they want the thing to fall on time. So they will squeeze almost 1/3 or even half of the gel on the cord to make the tea so messy. They just have to apply just a little quantity, just sufficient QS, to make it this thing. You are cheating me, madam. So that they can, be dry on time and then continue to apply. Because if they don't put enough there, sufficient quantity, they put all the cohesive gel there, it will not, it will be messy. And they should make sure that the thing is applied. You apply it from the top, the cut top, where they clamp the cord and cut. They should apply it from the top to the down, under the cord. They should not apply it from the cord down to the top, because the top has been cut. That is where invasion of the bacteria will come from. So you have to start the gel from the top to the down. That is another way we have to let the mothers be aware of it. This is a video I'm not going to show. When they were launching it at Rich Hospital, Accra Regional Hospital, this is the video that I captured there. But because of time, I'm not going to show, because it just comprises all the things I've talked to you about, the protocols, how to use it and everything. My brothers and sisters, please, let's make sure that the mothers adhere to these protocols. This is something that Minister of Health is saying we should stop using the methylated spirit and use this chlorhexidine. So those who are medical soups and other things, they are particularly are mentioned in some government hospitals. They don't want to use it. Why? They said they apply and it was not working for the mothers. Are you listening to the mother? What scientific basis have you got to say that it's not working? Prove it. You don't just use the word of mouth to say that you are not using it. Do it scientifically. We are all scientists. On that note, I say a big thank you.
Thank you very much, MNG. Okay, so we'll give you scientific evidence. We'll take the questions later, please. We want to call on NS Chemist. NS Chemist, are you ready? Okay, please, you have 10 minutes. I don't want to come and sack you, so please look at me.
Okay. Bye-bye.
10 minutes, maybe.
Thank you.
Good morning to us all, and I bring you felicitations from NS Chemist, especially on your 65th AGC. Yes. Thank you for the opportunity. This morning, I just want to quickly discuss management of BPH, benign prostatic hyperplasia, with phytotherapeutic agents. And since I've been warned, I don't know whether this works. I'll quickly skip to the main issue. Yes, so I'm going to quickly talk about two phytotherapeutic agents. The first one is saw palmetto. So saw palmetto is actually a small palm tree, particularly with red to blackberry fruits. And these fruits are actually harvested when ripe, and then partially dried and then prepared into extracts. And then, of course, tablets. And then these tablets have active ingredients like flavonoids, fatty acids, and high molecular weight polysaccharides. Now, the MOA, the mechanism of action of saw-palmetto, I'll just run through quickly. It mimics the action of 5-alpha reductase inhibitors by, of course, inhibiting the enzyme 5-alpha reductase, and therefore reduce the conversion of testosterone to dihydrotestosterone, which is the core property when it comes to benign prostatic hyperplasia, as in causing the prostate to swell. Now, it is well tolerated, and then it appears not to have any effect on the readings of the PSA, and therefore it's one preferred phytotherapeutic agent prescribed by physicians. Now, the next one quickly is nettle, Etica dioica. So nettle is also a herbaceous plant, and it has been known widely as its use in medicine, food, and fiber. Now, the modus operandi of the mechanism of action of stinging nettle is that it inhibits histamine, production of histamine. Yes, and also it sort of inhibits the production of pro-inflammatory prostaglandins like COX-1 and COX-2. Now, particularly the root extract serves to modulate certain substances like sex hormone binding globulins, aromatase, and then EGF, that's epidermal growth factors. Now, stinging nettle in combination with saw-palmetto is what I want to talk about. The two ingredients or the two phytoagents combined has received a lot of research, and therefore for its use in managing BPH. So there's been copious research on it. I'll just focus on just two of the research works. One that was compared, sorry. Okay. Yeah, so one that was compared with tamsulosin. In this case, 140 elderly outpatients suffering from LUTs caused by BPH with initial IPSS score of 13 or more were administered the combination products, being saw-palmetto and nettle combined, and then the other half with tamsulosin. And then at the end of it, it was done for 60 weeks. And then there were interim visits at weeks 8, 16, 24, and 48. Now, the change in IPSS score, as well as the percentage of patients with IPSS score less than 7 or equal to 7 points at the end points were measured. Now, the total score decreased from a median of 20 points in both treatment groups at the baseline to the medians of 11 and 10. That is, those with the combination had 11 from a median of 20 to those with the tamsulosin group getting to 10 points with the IPSS score. Now, 50.7, this is where my trust is, 50.7% of the patients in the combination group of the Etica dioica and then the net, and then the saw-palmetto, as well as 34% in the tamsulosin group, showed quality of life improvement by at least 2 points. And then considering the two was comparable, at the end of the day, the results were comparable. Okay, so the next was a comparison with finasteride. And at that too, about 543 patients were administered the combination of saw-palmetto and nettle, and then the next group with finasteride. Yes, and then the main parameter that was measured was the mean maximum urine flow rate, with other secondary parameters being average urine flow rate, and then mixing volume, and then the mixing time. And now a decrease of urinary symptoms was evaluated by using the IPSS score once again. And then during the trial was seen that the flow rate increased by 1.9 with the combination product. And then those on the finasteride also increased by 2.4, whereas the mixing time decreased in both groups in a similar fashion. So all these parameters just goes to show that the combination of nettle and then saw palmetto is comparable to the usual synthetic agents that we use. And then more importantly, there was a significantly lower incidence of side effects with the patients were on the saw palmetto and nettle combination. So this is the combination that has been used in a product I'm just about introducing to you, which is Prostinal. So Prostinal is a combination of saw palmetto and nettle, and there's copious research on it to back it. And Prostinal is by Stada, a company from Germany, and NS Chemist is the local agent for it. So it's a holistic formula, and it improves the quality of life of patients with prostate problems. It's a natural extract, so it's safe, and then the quality is also high. Now there are 3 varieties of it. So there's the Prostinal Forte, the Night, and then the Control. So Prostinal Forte has the basic ingredient, the saw palmetto, nettle, and then we've added zinc to it. So that's what I explained earlier, the mechanism of action of saw palmetto and nettle. And we added the zinc to maintain normal testosterone levels. Wow, I'll finish within it. So this is the Prostinal Control. It contains the same ingredients and amount. The required saw palmetto daily intake is 320 milligrams. So it's contained also in the control as well. But we just enhance the control by introducing Tribulus terrestris, which is a widely researched herb, which helps to improve spermatogenesis, improves libido, and then erectile function. Now, with this product, we want to target all men 40 and above. We are seeing that the incidence of BPH is usually 50%, going from 50 and even increases with age. So if we want to target the people 40 and above, then we need to just address other concerns that they might have, which is any sexual concern as well. So that is Prostinal Control. And then the last one is Prostinal Night. This one we want to target, or we are enhancing it for those who are having the BPH and having symptoms already, especially nocturia, waking up several times to wee-wee. So we've added an additional ingredient, which is ashwagandha. Ashwagandha helps reduce stress levels and therefore helps you have a good night's sleep, especially those who are waking up several times to wee-wee, whilst actually helping with the saw palmetto, nettle, and zinc in the right quantities, helping your prostate achieve good health. We are also adding these two, ashwagandha and then cranberry, to help the urinary function, as well as helping you have a good night's sleep. So this is just a summary of it. And then it's available in all NS Chemist shops at the moment. We're trying to get it through other shops throughout Ghana. So in Takoradi, we have NS Chemist shops here. Everywhere in Ghana, every region has NS Chemist shops. And these are the prices from us. You get the Prostinal Control at 98, and then the Night too as 98, and then the Forte, which is just the plain saw palmetto, nettle, and zinc, for 89. In conclusion, I want to say that phytotherapeutic agent presents a convenient option for patients in the treatment of LUTs attributed to BPH with minimal side effects. Now, currently, the research is still evolving, but in the use of the combination of saw palmetto and nettle, which is in my product, Prostinal, has been widely researched and therefore remains one of the best options for practitioners. Sorry, I think I was, sorry. Yeah. So that is the Prostinal Control, and that is, okay, so the Night is also there, but I think yes, that's the Prostinal Night. Yes. Thank you very much. Yeah.
Thank you very much, Ernest Chemist. Please let us note our questions. We would ask all 4 of them at the end. We call on East Cantonment. East Cantonment, are you ready? Okay.
And their products and things will be at their various stands. So you can always meet them and also ask them questions at that point. Thank you.
Yes.
You have 9 minutes, 59 seconds.
It's 59 seconds. We'll try very hard to do it. So, and I bring notice from the CEO, Mr. Ebenezer Mwafuhene, for the partnership that we've been having over the years. And we will show you, Jamie, but year in, year out, we will be here with you. And over the years, we've been your partner, and we'll keep doing that in the years to come. So just to let you know that this company is investment in an automobile warehouse. The motivation is to have storage facilities for heavy imports to supply across the country. And we build up our supply vehicles over 32 right now in country, so that you can have your products delivered to you at your doorstep in the right conditions. And these vehicles have got all the fitted storage conditions to bring the drugs to you in a very healthy state. And we have 2 different brands in country. It's working, right? Okay. So what we're doing is we represent a good number of the big brands across the world. So all your real and novel formulations, which you hardly find on the market, if you call on us, you'll get it. If you check at the back of your conference brochure, you will see our numbers there. So whenever you want, you can get in touch with us to get your products. So we represent both pharma and non-pharma as a new drug and drug companies. And I'll mention a few: Pfizer, Vitabiotics, MSN, Servier, Astra, Expert Johnson, and the rest. So when any of these products can come as countrywide, and we will serve you. Now, I want to make a mention to you of formulation from the French. It's called Bioderma. Currently, derma conditions need quite good attention from us as clinicians. And the French have had very good investment in research in getting formulations for the skin. And so we have Atodem, who is very good for atopic dermatitis. And then we also have Cicabo for skin repair. Our women who try all kinds of things just to clear the stretch marks and the wounds and the scars on the skin. A good formulation is now available in country. And then we have, it's not only the whites that must do sunscreen. In fact, currently, there is research to show that blacks tend to absorb a lot of the UV rays and the harmful ones for that matter. So we want to recommend that please get your patients to go on sunscreens. I mean, we are exposed to the sun almost all year round. So a very good sunscreen with a good safety profile can help prevent derma conditions on your patients. And then our Vitabiotic range, information of it to you that they're available in country for all hematinics and for vitamins across the age groups are available. We have the Wellcade, the Wellman, the Woman, the Menopause, the Osteocare, that are available countrywide. And I'm happy to see that my president is here, Mr. Samidonko. He's a PhD president. He has been advocating for local manufacturing. Okay, this slide is not going. That's not part of my time, Mr. President. Okay, good one. So East Cantonment have been thinking about how to enhance local manufacturing, and COVID gave us a very good lesson to learn that we must get our own in-country production. And Mr. Samidonko has been advocating that one across country. So we have produced our local generics. And so all the products you want to have access to in-country, we have them locally from South Africa. And we have the para that's bed. That brand is called Bida. It's our own brand. It's called Bida. So we have we have from Bida, Resveratrol, we have Carbocysteine, which is not very rare in the system. It's not being made locally in Ghana for access. So I'll let my colleague continue. And just to mention to you that
this continent is investing heavily in giving back to the community. So currently, we are working with the CEO of Korle Bu Teaching Hospital to donate, install, and train healthcare professionals on infusion pumps. And this is costing almost over $1 million Ghana cedi just to support healthcare in country. I didn't get a clap. Thank you very much. So sorry, here.
Okay, good morning. My name is Cindy Apiabusompim, and I'm the rep for BD, but with East Cantonment Pharmacy. So BD, it's the short form for Becton Dickinson. It's a manufacturing company in the US, and it's solely focused on medication delivery solution. So that's my portfolio. So anything that will help with medication delivery to make it safe and efficient, that's our focus. So I'll move forward. So since your theme for this year is advancing universal health coverage and who cares for the health worker, so this is to say that BD is here to care for the health worker. So we know that every time we are being exposed to needle stick injuries from time to time, and then it's being reported, but statistics says that 50% of the reports go unreported. And I know in our facilities, we have IPC sectors that record these things. We have these data, but what are we doing to be able to bring this thing to a minimum? So BD is here to help with that. So it says healthcare workers are exposed to the risk of contracting blood-borne infection through needle stick injury. So there are a percentage of exposure to HIV, hepatitis B, hepatitis C through all these needle stick injuries. So moving forward, these are the statistics from World Health Organization. So it says up to 8 million per year needle stick injuries happen in the US. And then we have 2,200 needle stick injuries happening every day. So my time won't permit me to go through everything, but these are the statistics that the US, the World Health Organization. So looking at hepatitis B exposure, we have 37 to 62% exposure, which is very alarming. So moving, please, this is not part of my, oh, why is it not moving? Yeah. It's not moving. Please, can someone attend to, please, the next. No, back, yes. Okay, so we have a lot of catheters on the market, and we are looking at the catheter with, related complications with these catheters that are on the market. And we have extravasation, phlebitis, infiltration, and then mostly these, looking at phlebitis, the mechanical phlebitis is mostly caused by how rigid the catheter is. So we've had stories from Tema General where the catheter broke into the person's vein and then they had to go and do a surgery. We've had a doctor also from the Northern region also said the same thing. So it's quite alarming for these kind of cases. Looking at, somebody will say it doesn't happen on the regular, but looking at the cost involved in trying to do the surgery, the trauma that the healthcare worker will even go through, or even the patient, because there was a story said it's moving, it's going into my heart, and now we are in the Gen Z generation. Someone just take a phone, record, oh, I went to this place, this happened, that happened, that happened, and it tends to tarnish the image of the hospital, the healthcare worker, and everything. Please, back. Yes, so BD has this catheter called the Venflon Pro Safety. So this is how it looks. I have a few that I would pass around and we would have a look at it. This would be my last. Yeah. Yes, so Venflon Pro Safety, so BD's cannula is called the Venflon, but then we've advanced it to call it the Venflon Pro Safety because it's giving you pro safety, like as the name says. So it has the catheter, it has many advantages over the other ones. So the material for the catheter and also the sheath that protects the needle when you disengage your stylet. So I'll briefly open one and then show how it works. Yes, so this is how the cannula looks like, and this is your safety sheath. So we know that we are not supposed to be recapping because of that's when mostly the needle stick injuries. So when you pull out your stylet, so this is how it starts to appear. Out the stylet, and then this is it. So the tip of the needle is shielded in here, so you can mistakenly it drops into a container which is not a sharp container. You know it's still safe because whoever is coming for the trash is safe. You, the healthcare worker, is safe. The patient is also safe. And as I said, talking about the catheter, it's very soft. It's made with a material called Valon. Yes, so it doesn't kink. You can bunch it, everything, it doesn't kink. So that goes to protect you from the mechanical phlebitis and everything that we spoke about the earlier ones. Please go back. That's the last one. No, forward. Oh, I'm done. Last one. Okay, please, that's it. Thank you very much.
Thank you very much. Please, we call on Famanova.
Good morning. Akwaba and Miawezo. I'm Eugene Saba. I'm a pharmacist and a medical representative of Famanova Limited. I'd like to use this opportunity to acknowledge the presence of executives of Famanova and Atlantic Life Sciences. We have in our midst Mr. Jitendra Srivastava, the General Manager of Marketing and Sales of Famanova. We have Mr. Gopal Singh, the Marketing Manager of Atlantic Life Sciences, and Mr. Praveen Srivastava, the Marketing Manager of Famanova Central, Eastern, and Volta regions. I also have my colleague pharmacist here, Mr. Dennis Brown, who's the medical representative of Atlantic Life Sciences, Central, Eastern, and Volta regions. Now, on behalf of Famanova and Atlantic Life Sciences, we welcome you to the 65th Annual General Conference of the Ghana Medical Association 2023. Okay, so Atlantic Life Sciences is the sister company of Famanova Limited. It's a Ghanaian brand. It's Ghanaian because it's owned by a Ghanaian. Mr. Daniel Tripathi is our CEO. He brought into corporation the company in 2021. He's Ghanaian by naturalization, and he's a practicing pharmacist in Ghana. It being a Ghanaian brand has created job opportunities for Ghanaians. We currently have over 350 Ghanaians on our payroll. Our medications are, we produce quality medications and we are compliant to current good manufacturing practices. Our medications are highly effective, affordable, and we have quite a wide range. So our objective is our objectives are partnering with medical service providers to help patients with different ailments, innovating with focus on quality and research, accelerating bench to bedside to make possible today's therapies of tomorrow, delivering global high quality products within reach in Ghana at affordable prices. All right. So for us said, Famanova and Atlantic Life Sciences are sister companies. Famanova was incorporated in 2005. And for the past 18 years, we've been among the forefront of pharmaceutical manufacturers and distributors in this country. Our focus is manufacturing and delivering innovative medications at affordable prices. And for all of us who are familiar with our products, you know we have a broad portfolio of prescription and over-the-counter medications. So this is our factory in Osu, behind the Kingdom Books and Stationery Lane on the Latu Accra Road. I'd like to give a brief reminder of some of our products. We are the first company to come out with friendly wallet packs of Artemether lumefantrine tablets, known as Novameter. We are also the first company to come out with hydrochlorothiazide combinations with lisinopril, losartan, and atenolol. Brand names being Lisinova HTZ, Losart HTZ, and Atenova HTZ. We are also the first company to introduce Ramipril in this country. And this is our cardioactive range. As you can see, as mentioned, we have Losart and its HTZ combinations, Amlonova 5 and 10, Lisinova 5, 10, and 20, and its HTZ combination. We have Atenova 50-100 and its HTZ combinations, as well as Ramipril, the statins such as Novastat 10 and 20, and our Benjo preparations, BDF 5 and BDF 2.5. So basically, we make tablets, capsules, capsules, syrups, and suppositories. We are also the first company to manufacture suppositories in this country. So prior to Pharmanova coming into this country, first pass effect was a big problem. So this is our product range. We make cardioactives, anti-diabetics, anti-malarials. We make diuretics, antacids, appetite stimulants, anxiolytics and antidepressants, antihistamines, anti-cough preparations. We make antispasmodics. We make large volume parenterals. We make analgesics and antipyretics as well as antifungals. Now, two molecules we've developed in combating antimicrobial drug resistance, meropenem and Novazone SB, which is ceftriaxone and sulbactam combined. Now, I'll skip through this and just touch briefly on the rationale behind combining ceftriaxone and sulbactam. Ceftriaxone is a powerful cephalosporin, third generation, as a matter of fact. It has similar mechanism of action as penicillins. It prevents cell wall synthesis by binding to penicillin binding proteins. And by doing so, it causes increased blood pressure in the bacterial cell, causing the cell to rupture, which is exerting its bactericidal activity. Now, ceftriaxone, as powerful as it is, in 2017, it was observed that it was beginning to experience a lot of resistance, about 50% resistance, meaning for every other treatment with ceftriaxone, you are likely to experience resistance. Now, a good way to combat that is by adding an adjuvant, which protects the ceftriaxone in circulation, helping it exert its mechanism of action or its therapeutic action. And we came out with Novazone SB. Now, we have studies that back the claim of Novazone SB. Ceftriaxone means a monotherapy for sepsis as compared to ceftriaxone and sulbactam in therapy of sepsis. You will realize the bacterial load is reduced by 17% in monotherapy of ceftriaxone, whereas in that of ceftriaxone sulbactam is 56%.
As soon as they move, tell me so that I'll get it.
It shows ceftriaxone offers a lot more clearance in bacterial load. Ceftriaxone sulbactam offers a lot more clearance in bacterial load than in ceftriaxone monotherapy. Now, our ceftriaxone sulbactam is available all across the country and it's accessible. It can get to you as soon as you need it. We also have meropenem, which is Novapenem. Our meropenem preparations are in 500 milligram and 1 gram. As we all know already, meropenem is a carbapenem, also a similar mechanism of action as the penicillins and the cephalosporins. This is... And ceftriaxone in practice is usually a last resort medication. We usually like to start empirically with antibiotic application, but in situations where, say, the patient is brought from somewhere far and you have no access to pathological data or any susceptibility testing, an ideal approach would be to go straight to meropenem. It has a wide range of susceptibility to anaerobes, aerobes, gram-positives, and gram-negatives as well, with very little resistance observed. Little to no resistance observed. It has low protein binding, so it gets in and gets out as soon as possible without exerting as many side effects as the other antibiotics will. So meropenem is usually indicated for complicated skin and skin structure infections and
In cases of resistance as well, acquired also.
Yeah, sorry. So yes, another product I'd like to move on to is levofloxacin, which our preparation is known as Levoxin. And levofloxacin is a fluoroquinolone. Exerts its action by inhibiting DNA gyrase, and by doing so, it causes the bacterial cell to break its DNA strands and eventually die. Now, levofloxacin is a very powerful antibiotic, and it has a lot of indications. So I'd like to give you 2 key indications. Community-acquired pneumonia, nosocomial pneumonia, or hostile-acquired pneumonia, some people would like to refer to it, and complicated urinary tract infections. Now, levofloxacin gets into urine almost unchanged. So you can imagine that quantity of levofloxacin in that region is very, very powerful when it comes to urinary tract infections. But as said, we are advised to treat empirically, but if you are running out of options, it's a very excellent option for you. One more product I would like to talk about is our fluconazole IV preparation. Yes, you heard me right, it's fluconazole IV. No other company is making fluconazole IV. We are the first to come out with it. Now, why fluconazole IV? So in cases of systemic fungal infections, such as oropharyngeal candidiasis, where the patients may have difficulty swallowing the normal fluconazole tablets and capsules, an ideal approach would be to go intravenously. Now, most patients find, like I said, they find it difficult to swallow and drink water or even eat. You can treat them in immunocompromised patients, for instance, who are prone to fungal infections. An ideal way of giving them some prophylaxis is using fluconazole IV. So once again, I'd like to thank you all for giving us your precious time. I'd like to thank the medical superintendent who came to our factory in Pram Pram to have a tour of the place. A few weeks ago, we also hosted a Ghana Medical Association executives at our factory, and we gave them a tour. We thank you all for patronizing Famanova and Atlantic Life Sciences. And also, I'd like to wish everyone good luck on the raffle, which we will announce the winner tomorrow morning at the business section of the hotel. Thank you very much once again.
Thank you very much, Famanova. Yes, please. Questions for Famanova, MNG, NS Chemist, and East Cantonment. Please, we are taking 3 questions. 4 questions, 1 for each. Okay, thankfully, no questions.
Please, our invited dignitaries at the high table are ready to come in. And please, as soon as they enter, please, shall I plead that we'll all be upstanding to receive them. Thank you very much.
I know that. I know that. How we introduce also we just want he has a lot of
Shall we be outstanding as we see the high table?
What? So what I need, I will introduce the people on the high table when they sit down. Okay. And then by you going, I will leave the chair out. And then you introduce the chair. He only wants the title. 9 million of the second, but you have it. That is all. Okay, just say it's a well-respected chief. So there's a few words. Then Mike. Another morning, special, but only 10. How do we do it? How do we do it? Okay, that's fine. Another so would like to know, maybe something done or say you only want a man in office. So we'll introduce you last as the chair. So he would introduce you. I will leave you out. I will introduce everybody and leave you out. Then we'll do. Then she'll come to you. Then you move to the speech so that we'll be fast.
Wow, wow, wow. Isn't culture beautiful? Thank you so much, our members and everybody here gathered. And thank you to our high table. Now the ceremony can properly begin. You are welcome to this morning's official opening ceremony of the Ghana Medical Association 65th Annual General Conference. And we'll quickly move since time is fast spent. On our high table, we need to know those at the high table. And I'll start from my extreme left. And Dr. David Kofi Owusu is the divisional chairperson hosting today's meeting. Shall we receive him with a round of applause? Also on the high table is the man who pays all our bills when we go to the hospital. Sometimes we fight with him brutally as facility managers when the payments delay. After this presentation, we'll lock him up in one room and extract every CD out of him. Dr. Bernard Okoboy, the CEO of National Health Insurance Authority. Also on the high table is one of our members. He's also a fellow of the association, but now he is the presidential advisor on health, Dr. Anthony Siasare. At the extreme left is the vice president of the Ghana Medical Association, Dr. Justice Dufu Yangson. I'm told that I have to pronounce the name in the right order. So, Regional Minister, please, if I miss the order, allow me to leave the region peacefully. So, Honorable Kwabena Oche Daakun Mensah is the Regional Minister of the Western Region. Shall we give him a big applause? If he didn't permit us, we probably wouldn't even have the event over here. Also sitting next to him is Honorable Abena Osei Asare, who is also the Deputy Minister of Finance and is our special guest of honor. Then we have seated next to her a very well-respected chief, I've listened to some of his speeches. The man has serious punchlines packaged in nice, beautiful English language. Probably he's one of those who will take over from President Boom, who has passed on, but he does it in a more nice way. Nana Kobna Inketia the Fifth, Omahine of Esikado traditional area. He is our keynote speaker for today, and I believe former President Rawlings will be in the room to see what he will do. I'll leave it to one person for the moment, and my co-MC will introduce him right now. So Nana just whispered something to me that Sankofa Yenchi. So I'm going back. We unfortunately missed just one person who has joined the high table, and that is the representative of the Regional Director of Health Services for Western Region, Dr. Gifty Amugi, who is the Deputy Director of Public Health. Okay. So Hectoria, please do us the honors.
Thank you, Richard. So I'm honored to introduce the last person on the high table. And this last person is no other. He's a friend, he's a colleague, a senior colleague. He's a medical soup. And he started in this division as a young leader. And today we celebrate his achievement. We celebrate all that he has led GMA to achieve. And we call upon our president, our own president of the Ghana Medical Association, Dr. Frank Serebour, as the chairperson. Please louder, louder for him, louder for him, louder for him. It's also an endorsement.
So President told me that if the clap is not loud, he might throw 1 or 2 bombs. So please, shall we do it louder and harder so that we can soften his heart? Even bringing his wife in has not done the full trick yet. So at this juncture, we'll call the chair. Just go. Okay. So just a few tweaks. He's preparing and calming down. And so we'll take the fraternal messages at this point. And we'll first call on the president of the Pharmaceutical Society of Ghana to give us the message from the PSG. Thank you. Let's receive him with applause.
Good morning to everyone. Chairman of the occasion, the president of the GMA, then our thematic speaker, Nana Ngatia of Esikado traditional area. Just a few days ago, I was with him on the same program. Little did I know I'll be meeting him here today again. So it looks like you are indeed a friend of the healthcare profession. The CEO of National Health Insurance, my old good friend as well. My very old friend, presidential advisor on health, and the Honorable Regional Minister, who was also a special person to us when we had our AGM in Takoradi. The Honorable Deputy Minister of Finance, who has also been very supportive of the Pharmaceutical Society of Ghana. So looking at the high table, it looks like almost everyone here is a friend to the pharmacy profession. I stand before you today as the president of the Pharmaceutical Society of Ghana, PSGH, having been elected having been elected at our recently held annual general meeting and conference in this very city of Takoradi in September this year. It is therefore a privilege to contribute a brief fraternal message as we collectively explore on the theme of advancing universal health coverage. Who cares for the health worker? At the 65th Annual General Conference of the Ghana Medical Association. In the pursuit of universal health coverage, it is crucial that we recognize the symbiotic relationship between pharmacists and medical practitioners. Our collaboration is integral to the holistic well-being of our communities. As guardians of pharmaceutical care, we share the responsibility of ensuring that every individual, regardless of their socio-economic status, has access to quality healthcare services. The team resonates deeply with the challenges and triumphs we as healthcare practitioners encounter daily. It prompts us to reflect on the well-being of those on the front lines, the healthcare workers who tirelessly devote themselves to the service of others. They are the backbone of our healthcare system, and their welfare should be at the forefront of our collective consciousness. As you deliberate on the advancement needed for universal health coverage, let us not forget the importance of fostering a supportive environment for our health workers. This includes adequate training, fair remuneration, and the provision of resources to enhance their effectiveness. By investing in our healthcare or health workforce, we invest in the foundation of a healthier, more resilient society. Moreover, I encourage the Ghana Medical Association in the process of electing new executives to prioritize visionary leaders who will understand the evolving landscape of healthcare, leaders who will champion collaborative efforts between different healthcare disciplines, breaking down silos to achieve a more integrated and patient-centric approach, as has been done by your trailblazers. We, the Pharmaceutical Society of Ghana, would therefore wish you very successful elections, as we did a few months ago. At the annual general meeting of pharmacists in September here in Takoradi, our thematic speaker, Dr. Sam Jonah, asked professional bodies to speak up, be the voice of the voiceless on national issues. DSGA, the Pharmaceutical Society of Ghana, therefore looks forward to collaboration with the Ghana Medical Association to speak up jointly on health issues and other issues of national health concern. Indeed, we look forward to seeing press releases, press statements coming jointly from the two associations. Not only are we going to speak up on national issues collaboratively, we also look forward coming together to see how we can review the laws that governs our profession in a way that will make our professions better and improve. In closing, let us remember that the path to universal health coverage is not a solitary journey. It is a collective endeavor that requires the commitment and collaboration of every healthcare professional, including pharmacists and physicians. Together, we can build a healthcare system that truly cares for the health worker, ensuring that they in turn can provide the best possible care for those in need. The PSGH, therefore, look forward to a communique that will come out at this conference. We once again want to thank you for the opportunity and for inviting us here. Thank you for your attention. And ladies and gentlemen, the media, we want to say that thank you for giving us this opportunity to be present here. Long live the Pharmaceutical Society of Ghana. Long live the GMA. Long live executives of GMA. Thank you.
Let's make the applause louder. It's PSG people. If we don't give them loud applause, there will be a shortage of drugs in the system. Please, do we have a representative of the Ghana Registered Nurses and Midwives Association? Okay, so can we have Dr. Kamaruddin Hussein, who will speak to us from the Medical Superintendents Group? Shall we receive him with an applause?
Good morning. President, Chairman, all protocols observed. I bring you greetings from the Medical Superintendent Groups of Ghana. As members of GMA, it is not out of place to congratulate ourselves for organizing our 65th AGC here in Takoradi in the Western region. The theme for the Congress, Advancing Universal Health Coverage, Who Cares for the Health Worker, is very apt in the circumstances. Dr. Chair, let's look at universal health coverage in three perspectives, using the analogy of the 3 P's of labor, those who still remember their ONG. The powers, the passage, and the passenger. Now, the passenger is the elephant we are calling universal health coverage. The passage, those beautiful government policies and programs, and the powers, the resources. But I'll focus on the human resource. Dr. Chair, until very recently, not much emphasis was laid on the health of the powers that is supposed to deliver the universal health coverage. That is why we in the Medical Superintendent Group are happy that GMA has chosen this theme to highlight the plight of the powers without which the passenger cannot be delivered. We in the Medical Superintendent Group might be tempted to give this topic another showdown in our own AGM next year, depending on how this subject matter is attended to by all during the coming weeks and months. It is in this light that the Ghana Health Services policy on staff clinics must be embraced by all of us and be implemented in all facilities without delay. The issue of unavailability of space should not be an excuse for managers' inability to establish a staff clinic in their various facilities. We can assign the most qualified specialists to attend to our staff, whilst we make effort to create consulting rooms to be dedicated to specialists to attend solely to our staff. We should be able to pay the NHIS premium for our staff who cannot afford. And let us also institute exemption policies for our staff, as well as welfare contributions to fall on in terms of medical emergencies as we await government to implement the healthcare component of our condition of service. Dr. Chair, it doesn't sit well with my conscience that the cook who prepares food to sell to the public pays for the same food to eat to keep her strong and fit to continue to provide for the public. If the medical director can waive off a purpose bill without attracting audit queries, what stops him from waiving off any staff's medical bills, irrespective of place of work or category of staff? In conclusion, Dr. Chair, universal health coverage can never be achieved without the help of the powers, the staff. So the earlier we invest in the powers, the better for us all, because a weak and sick power at best will deliver a CP baby if it misses a stillbirth. Luckily, the power to decide on the welfare and healthcare of the powers is in the hand of medical directors.
and superintendents who themselves are part of the powers. I know we can do this. Let's give it a try. Never should a staff be denied access to the most qualified specialists, nor the most advanced medical technology, nor made to pay for medical services in our various hospitals. It will not run our hospitals down. Dr. Chair, the mental health status of an individual is greatly influenced by the money he has or robbed off. That is why I employ my colleagues, medical superintendents and directors who are still not paying the statutory 13th month allowance to engage us, the seniors, to show you the way. In fact, there is no excuse, no matter how big or small your facility is. You are doing a disservice to achieving universal health coverage, since a hungry man is an angry man with unstable or unhealthy mental state. Remember, you will not occupy that position you are in forever. If you are lucky to be engaged on contracts after retirement and back to the same system, you will be painted with the same brush you left behind. On that note, Dr. Chair, I wish you all a happy and fruitful deliberation. May this 65th AGC to be a success. Long live the medical superintendent group. Long live the GMA. Long live Mother Ghana. Thank you. Wow. So, thank you, Dr. Hussein. Thank you, Dr. Hussein. You know, one of my friends used to say that if you don't take care and invite a very handsome man to your wedding and he comes too early, next thing you know, the bride is nowhere to be found. And I'm beginning to think that, Dr. Hussein, you are banned from any wedding and banned from speaking at any function. Because if you don't take care, you cause trouble. We would also invite Dr. Simon Bene, Regional Chairman, Ghana Veterinary Medical Association, to give us a brief solidarity message.
Good morning. I stand on the already established protocols. I bring you greetings from Ghana Veterinary Medical Association President, Dr. Cyril Thaddeus Quist. We congratulate you and wish you good deliberation in the annual general meeting of Ghana Medical Association. The team, Advancing Universal Health Coverage, who cares for the health worker, is so relevant today, especially when 75% of emerging and re-emerging diseases are of animal origin and very dangerous to manage. The Ghana Medical Association, which was formed in 1958 with 40 members, currently holds over 7,000 members, believe in the total well-being of all Ghanaians. The Ghana Veterinary Medical Association is committed to partnership and collaboration with the Ghana Medical Association in all the management and investigation of diseases of animal origin in the name of One Health. I wish to encourage you to support some of your members to aspire to be policymakers, because it takes one good policy to achieve the theme of the annual general meeting. I say, silence is worse. All truths that are kept silent become poisonous. We know silence makes no mistakes, but he who is silent is forgotten. He who stops, overwhelmed, distanced, and crushed. Please, may you have a fruitful meeting. Long live Ghana Medical Association. Long live Ghana Veterinary Medical Association. Thank you.
Thank you very much, Ghana Veterinary Medical Association. We are going to have a welcome address by the chairman of GMA, Ghana Medical Association, Western Region, Dr. David K. Owusu. But before he comes, we want to acknowledge the presence of a few guests amongst us. We want to acknowledge the presence of FOC Commander Emmanuel Kwafu. Please, let's see you if you are here. FOC Commander Emmanuel Kwafu, Western Regional Commander, Ghana Navy. We want to acknowledge the presence of Air Commodore Godfred Saki, Western Regional Commander, Ghana Air Force. Deputy Director of Prisons, Abraham Nimoy Alote. Okay. Western Regional Commander, Ghana Prison Service. Then we acknowledge the presence of Deputy Commissioner of Immigration, Fred Amankwa. Yes. We also acknowledge the presence of Apostle Eko Ansa Agri, founder of Fountain Grace Royal Chapel. All right.
Also present here is ACFO 3, Thomas Ni Okai Tete, Deputy Regional Fire Officer, Western Region. We'll stop at this point and acknowledge the many other dignitaries with us as we go along. But we want to acknowledge the presence of all members of GMA, our council, and then our revered fellows who are among us. Let's give ourselves a big, big hand. So we shall now call Dr. David Kofi Owusu to give us his welcome address.
Thank you very much and good morning to everyone. Mr. Chairman and President of the Ghana Medical Association, Dr. Frank Srebo, Nana Kobna Nkatia the Fifth, Omahene of the Iskados traditional area. Honorable Kweku Ajimamenu, Minister of Health, Honorable Kobna Ochre Dakum Mensa, Western Regional Minister, Honorable Abna Osei Asare, MP of Etiwa East and Special Guest of Honor, Members of Parliament present, Dr. Anthony Adolfo Ofosu, Deputy Director General of the Ghana Health Service, Dr. Bernard Okuboy, CEO of the NHIA, representative of the Regional Health Director, Dr. Amugi, Nananum, Regional Chief Imam, Reverend Ministers present, past President and Fellows of the Ghana Medical Association, distinguished council members of the Ghana Medical Association, colleague doctors nationwide gathered here in person and online, other health workers, friends in the media, ladies and gentlemen. On behalf of the leadership and entire membership of the Western Division, I warmly welcome you to this all-important 65th Annual General Conference of the Ghana Medical Association themed Advancing Universal Health Coverage, Who Cares for the Health Worker? As we are all aware, even though great strides have been made towards the attainment of universal health coverage, we have a long way to go. By universal health coverage, we mean having access to quality healthcare services wherever you are, irrespective of one's financial status. This also requires that skilled workers are equitably distributed and are in turn supported with regular training, logistics, and other resources to work whilst enjoying decent pay. We would agree that this is a multifaceted challenge and would require an equally measured approach to achieve this goal. We all have our part to play. in our own little way, we can play various roles that can culminate into success, i.e., 1, creating a cordial environment at the workplace where we can nurture and help develop the next generation of skilled labor in the health sector. 2, being responsible in the management of resources made available to us so as to discharge our duties efficiently. 3, being disciplined enough in order to reduce wastage of resources, avoid malpractices, and eliminate corruption. At the individual levels, let us also take care of ourselves in terms of our physical, mental, spiritual, and financial well-being. So I ask again, who cares for the health worker? I say it is our collective responsibility to care for ourselves. As a division, we are very grateful to the Council of the Ghana Medical Association and the entire membership for the privilege of hosting this year's annual general conference. Whilst you are here, make new friends, relax, find time to enjoy yourself, visit tourist sites in the 2 regions, and enjoy your stay in Sekondi Takoradi. I once again welcome everyone present here in person and online, and hope we come up with sustainable solutions that will move our dear nation a step further towards the pursuit of universal health coverage. Long live the Ghana Medical Association. Long live our dear nation, Ghana. Thank you very much.
All right. We want to acknowledge, thank you very much, Western Regional Chairperson. We want to acknowledge also the presence of Awolai Atibrukusu III, Omahene of Lower Axim. Please, you are welcome and thank you for joining us. We want to also acknowledge the presence of Imam Adam Buddha. Imam Adam Buddha. Thank you. Sheikh Zulkifli Abdul Wahid Umar, Regional Chief Imam Representative. Himself, sorry. Sheikh Zulkifli Abdul Wahid Umar, Regional Chief Imam. Thank you very much. We also want to acknowledge the presence of Alhaji Bwachi Yadom, AK, Principal NMTC Sekondi. Thank you very much, sir. We now call on our regional minister, the host, Regional Minister, Honorable Kobna Otrida Kumensa, to give us his welcome address. Please let us welcome him with a clap.
Thank you very much. Nana Kobna Nkatia V, Paramount Chief of ISCADO and Chairman for this great occasion. The Honorable Deputy Minister for Finance and MP for Etiwa East. The Presidential Advisor on Health, Dr. Sia Asari. The Chief Executive of the National Health Insurance Authority. My own MMDC is here present. The Regional Directors of Health here present. The President of the Ghana Medical Association and all the presidents of the regions here present. Here present. Members of the Ghana Medical Association and healthcare professionals here present. Distinguished invited guests, media, ladies and gentlemen. Good morning to you all. I am honored to welcome you to the Western region. And like you know, the best is always in the West. To the region, to the conference. The 65th Annual General Conference of the Medical Association, the team advancing universal health coverage, who cares for the health worker. The central theme of this conference underscores the pivotal role of our able health workers in the collective mission to achieve universal health coverage. As healthcare professionals, you are at the forefront of delivering quality healthcare services to the various communities, and it is incumbent upon us to consider who cares for the health worker as we strive for this noble goal. We all know that the backbone of any effective healthcare system is the skilled and dedicated individuals who work tirelessly to ensure the well-being of the citizens. Yes, I'm speaking about you, the invaluable healthcare worker who dedicate their lives to the noble cause of saving lives and improving health of our communities. Health workers are the unsung heroes of our society. You work tirelessly, often under challenging circumstances, to provide essential care to those in need. It is imperative that we recognize and acknowledge your dedication and sacrifices. Ladies and gentlemen, in Ghana, we are proud to have made commendable progress towards achieving universal health coverage. However, it is essential to acknowledge the critical role of our health workers in this quest. They are the ones who are at the forefront, working day and night under challenging circumstances to deliver essential services to our own people. The question that arises today is, who cares for the health worker? Ladies and gentlemen, it is vital to ensure the well-being and welfare of our health workers. For without their physical and mental well-being, our fight for universal health coverage will be compromised. Our health workers face numerous challenges that often go unnoticed and unaddressed, leading to burnout, high attrition rates, and ultimately a weakened healthcare system. One of the significant challenges our healthcare workers face is inadequate human resources. The demand for healthcare services is continually increasing, yet the number of healthcare professionals remain insufficient. This results in heavy workload, long working hours, and increased stress level among the health worker. Distinguished invited guests, we must also acknowledge the importance of a conducive working environment. The government over the years has been striving to provide adequate facilities and a better living condition to support the delivery of healthcare services in the country. It is a duty to address the challenges and ensure that every health worker has access to a supportive work environment, necessary facilities and resources to provide quality care to our citizens. And whilst providing these facilities and resources, we believe that the managers who also work in the facilities support and make sure they are used appropriately to support the healthcare worker. Additionally, we cannot overlook the issue of remuneration and recognition, which government is standing up to. Our health workers, we all agree, deserve fair compensation for their dedication and hard work. Whilst government is committed to improving the salaries and benefits of health workers, motivating them to stay in their profession is our greatest priority. Additionally, it is in the right direction to acknowledge the contribution of health workers and create platforms for recognizing their achievements and successes, boosting their morale and job satisfaction. And like you are aware, just after COVID, government all over the country were able to organize recognition ceremonies for all the health workers that made an impact during the COVID period. The Western region did the same. Ladies and gentlemen, there should be continuous education and training to keep skills sharp and updated. We must advocate for opportunities for healthcare professionals to enhance their knowledge and abilities. The healthcare landscape continuously evolves, and it is a responsibility to ensure that our healthcare workers are equipped with the latest technology and knowledge and skills to provide the best possible care to our own people. By investing in your professional growth, we not only improve individual competence, but also enhance the overall quality of healthcare services in our region and Ghana as a whole. I stand before you today, not only to acknowledge the incredible contributions and sacrifices made by health workers, but also to pledge our commitment and support in addressing concerns and advocating for your rights. Ladies and gentlemen, at this juncture, let us remember that by caring for our own, you, the healthcare worker, we enhance our ability to care for our citizens. Our dedication to advancing universal health coverage is inseparable from our commitment to the well-being of the health worker. Together, we can ensure that no one is left behind in the pursuit of quality healthcare for all. I believe that once others are looking at opportunities in other parts of the world for greener pastures, I believe we can water our own garden to be greener. Therefore, let's look for new innovations and new opportunities and new thinking to create what we want in our country. Because in doing so, the country will be greater and stronger. On this note, as I finish my speech, I'd like to once again welcome you to the Western region and also invite you to our 24th, 25th, and 27th Christmas Masquerade Festival we call Anchors in Tadi. And like I said, in the past, we said the best always came from the West. To tell you, it's still West. Western region, long in Ghana. Thank you very much.
Thank you very much, Honorable Minister. At this point, we want to acknowledge the regional chief imam. Today is Friday, and he would like to take leave of us to prepare for prayers later this afternoon. So if you see him leaving, that is the reason why he's leaving, but he's still here with us in spirit. Okay, thank you very much. Okay, we want to acknowledge the presence of Deputy Executive Director of Christian Health Association of Ghana, Dr. James Dua. He's here with us. Please let us welcome him. Thank you very much, Dr. Dua. Deputy Executive Director, CHAG. We also want to acknowledge the presence of all our regional health directors who are here. We acknowledge the presence of Dr. Kofi Amokodie, Bono East, Bono Region, Dr. Kofi Amokodie. Thank you very much, Director, for making time. Dr. Osei Kufo Afre, Oti Region. Thank you very much, Director. We want to acknowledge the presence of Dr. Samuel Boache Boateng, BB, popularly known as BB, for the Upper East Region Health Director. We acknowledge the presence of Dr. Marion Oko Owusu, Central Region. our past treasurer. Thank you very much, Director. We also want to acknowledge the presence of Dr. Lawrence Ofori-Boadu, Acting ICD Director, Institutional Care Division, Ghana Health Service. Director, we didn't see. Okay, you're welcome. Okay. Okay. At this point, we are going to call on our Honorable Dr. Bernard Okoboy, CEO of the National Health Insurance Authority, to give us his word.
Thank you very much. Madam Chair, my own senior sister, the Deputy Minister for Finance, the Regional Minister, the Social Advisor, the President of the Ghana Medical Association, all members of the high table, all invited guests, ladies and gentlemen. I find it a great honor to be given the space to make a few comments at this well-organized AGC of the noblest professionals in the world, physicians. I bring greetings from His Excellency the President, Nana Addo Dankwa Akufo-Addo, and the Minister for the sector. Some 18 months ago, I found favor with His Excellency the President, who appointed me as the CEO of the National Health Insurance Scheme, and for that matter, the authority as well. Since assuming office, I have strived hard to lead the organization to improve its relationship with providers, practitioners, and other stakeholders, physicians inclusive. Our responsibility at the scheme is to pay claims promptly. This I am committed to, this we are working at, and this we shall continue to pursue as an organization. Please, we have a responsibility together with all stakeholders, GMA once again inclusive, to educate Ghanaians on healthy living, regular health checks, as well as ways to pull resources together to put each other pay for medical care. Today, the cost of medical care has become a national issue. I thank God it has come to the table. As physicians, it is good to speak to issues on our welfare, but also equally important is for us to be interested in ways to help our patients afford health care. It's not the duty of just the politician or the NHIS to find ways of funding kidney care. We are also part of the solution. All of us must be interested in how to do it. Indeed, it is only when we all come to the table with ourselves that the solution we seek shall arrive sooner than later. It is possible to not only fund kidney care, cardio, hepatic, and other organ-related pathologies too can be funded. What is lacking is an honest, incisive, solution-searching conversation that being part of the solution rather than being a propagator of the problem. We are working at the China to define the boundaries of renal care financing. The committee, as I speak, is working on funding pathways. I am optimistic that the Akufo-Addo government will soon announce a comprehensive plan for sustainable health financing in renal care. We also have to work on all the threats that face the NHIS. For any practice that threatens the payer and also endanger the life of the patient. Illegal charges, also referred to as unapproved charges, from patients who are on the scheme is a big problem. I guess so is the delay in paying claims. We have improved on claims payment. Providers are also encouraged to improve behavior towards clients. And let me take the opportunity to say that as we speak, we have a policy we refer to as a sunshine policy. So all the payments we make are on our website. If you go to NHIS,
health.gov.gh on your phone now. In the top left corner, you find options. When you click, you see claims payment. I just clicked, typed in Suhum Government Hospital, typed in Suhum Municipality. When I searched, it came out. The last 3-4 months, what Suhum Government Hospital has been paid, the amount is there. The month for which they were paid, the month is there. And the date on which they were paid is there. 2nd November, just 8 days ago. Sometimes, in fact, it's not sometimes, most of the time, internal injuries kill quicker than external ones. As members of the profession, we must be interested in what is happening in our hospitals. Because sometimes when you know your injury and you start recovery, it helps to do better. And this is not out of malice for anybody, but I'm one of the public officers who believe that transparency is the best way to find solutions. And so any hospital that you work in, when you type in the name of your hospital, you will know what is coming in. This would shape the conversations wherever you find yourself. I am committed to, no, we are not enemies in this sector. We all work towards the welfare of the Ghanaian. I am committed to working with the GMA to ensure liquidity in the health sector. I pray for support from the GMA to ensure sustainability and confidence in the scheme. I mean the NHIS. I congratulate the GMA president and his executives for a well-organized agency. To those who are contesting for positions in GMA tomorrow, I wish you well. For those of us going to vote, I urge you to consider a woman wherever there is one. I am a gender advocate. Sorry if you are a man and having to compete, a woman. And by the way, this is personal. The NHIS dissociates itself from this position. Ladies and gentlemen, members of the movement profession, I salute you all for keeping faith with your executives, I mean executive of the GMA and with the NHIS. May competition always win. God bless you all for coming. I thank you very much.
Thank you very much, Honorable, and thank you for the endorsement of women. And we will prove ourselves worthy. Yes, we want to continue the acknowledgement, and we want to acknowledge the presence of Regional Director of Northeast, Dr. Brahima Abubakar. Dr. Brahima Abubakar, thank you very much, Director. He's also my teacher. We want to acknowledge the presence of Dr. Kojo Tenkran, Ashanti Regional Health Director. Dr. Tenkran, he was here this morning, yes. Dr. Emmanuel Achidodo, Ahafo Region. Dr. Fred Adomako Boateng, Bono East. Thank you very much, Director.
Right. So today we are all gender advocates, and it's okay. But at least you can see that GMA, we don't joke with gender. That is why it's 50-50 chempe. 50-50. 50. I am too low. Okay. So we would want to do some special acknowledgements of very important people when it comes to GMA circles. When it comes to GMA, beyond the General Assembly, the highest decision-making body that superintends over the executives is the Council of the Association. And these are very important personalities who commit their time and everything that they do to make sure things run well, contribute to policy and etc. So we'd like to call on all council members here present to please be upstanding and let's acknowledge them. All council members of the Ghana Medical Association. All council members. In fact, these people, if they don't approve the budget, we can't have this ceremony. So we thank you very much. Please, you may now have your seats. They are very, very powerful people. All the time, we have to make sure we are in the right books. Beyond them also, we have the fellows of the association. These are people who have served the association served the country in various capacities, and the association accords them the highest form of honor, which is called the Fellowship Award. And in the association, only very few people ever even get that. And today, I'm sure you will see a few people and you will acknowledge what they have contributed to society in diverse ways. So we'd like to invite our dear fellows to be upstanding for us to acknowledge them. All fellows of the Ghana Medical Association. You can see Prof. Hesse, surgeon par excellence, the husband who has taught almost all of us, Prof. Edouard Babio, COP AUC. One of them is behind me and is looking at me dangerously, that if I don't mention his name, I'm in trouble. Dr. James Amoateng, and then also Dr. Samuel Boating. We thank you so much for your service. And then, last but not the least, in fact, only few people, even fewer, get to be presidents of the association. The president of the association is the embodiment of every single doctor in this country. So when you become president, it's not about you anymore. Your whole life is for the association. Your wife has to buy time from the association. In fact, president will confess, I just received his wife's application. I'm canceling 1 or 2 hours of it for this evening. So we would like to acknowledge the past presidents of the association who are here present together for us to acknowledge them. The past presidents of our association. Dr. Francis Edouard Babio, and then one of the men, his proverb is, powerful medications come in small bottles. If you know him, you know. So I won't mention his name. And if any other former executive associations here, kindly be upstanding for us to acknowledge you for all the service that you've done. Dr. Marion Oko-Usu, former treasurer. Dr. Abi Mahama, Prof. and Mrs. They domesticated the association at a point. And then Dr. Titus Bayo, who resigned and I took over as his acting, is now going to the big, he wants to go into the big house and become honorable. Dr. Bayo, we salute you. He said, Dr. Nsiansa, he says, Obama will show down. Dr. Nsiansa, Nyaminka Wakuma, why?
Yes, at this point, we are going to call on Dr. Connie Thomas to give us a musical interlude. Dr. Thomas.
So you will see that doctors, we are not boring like that. We have other talents that the big books have suppressed, but Dr. Connie has refused to suppress his own. Should we hold the mic for you? You can sing along. Heaven knows how we will get there. We know we will. Wow. Shall we clap for the man? Shall we clap for the man, Thomas Conning? In fact, he is a man of many parts. He is an obstetrician gynecologist. The women know what it means. And he's a very talented one. You know, this thing, I know how to play it, but the last time I tried, I was only blowing air. So it's not easy like that. It's not easy like that.
Yes, Richard, it's really true that it will be hard to get to a total well-being of the health worker. It will be hard, but we will get there. We will get there.
We'll get there.
Yes, we will get there.
Get there.
Yes, thank you very much. At this point, we want to call on our president and the chairperson of today's 65th Annual General Conference to give us his conference address. Please let us welcome him. Louder, please.
My acting general secretary is wrapping me. He says I shouldn't tell anybody that, or all of you, that I taught Dr. Conning how to play the flute. In fact, even yesterday in the evening, he was in my room taking lessons. And what I'm going to do is that next time I'll teach him the wrong thing. So, as usual, I will start my speech with Psalm 91, verses 5 to 7 this time. You will not fear the terror of night, nor the arrow that flies by day, nor the pestilence that stalks in the darkness, nor the plague that destroys at midday. 1,000 may fall at your side, 10,000 at your right hand, but it will not come near you. It will not come near you. Honorable Deputy Minister of Finance, Honorable Abna Osei-Asare, Member of Parliament, Atiwa East, and the special guest of honor for the 65th Annual General Conference of the GMA, Nana Kobna Nketia, the 5th Omanhene of Esikado Traditional Area and the keynote speaker for today's event, the Western Regional Minister, Honorable Kwabna Ochredako-Mensah, the Western Regional Director of Health Service, represented by Dr. Gifty Amugi, the Deputy Director of Public Health, Regional Directors of Health Services, the Advisor to the President of the Republic of Ghana on Health, Dr. Anthony Nsia-Sarri, who happens to also be a fellow of the Ghana Medical Association, Dr. Lawrence Ofori-Boadu, Acting Director, Institutional Care. If I don't acknowledge him, I am sure those of you who are seeking position to become deputy directors, district directors, when I go to him, he will sack me. So I have to acknowledge him. Dr. James Dua, Deputy Executive Director of CHAG, the President of the Medical Superintendents Group, who will never be invited here to come and speak again, Dr. Kamarudin KK Hussein, Honorable Dr. Bernard Okoboy, CEO NHIA, who wants to expose us by publishing everything online, distinguished traditional rulers, religious leaders, security agencies present here, the Council of the Ghana Medical Association, past presidents and fellows of the Ghana Medical Association, members of the Ghana Medical Association, sister associations duly represented here. I see the president of the Pharmaceutical Society of Ghana, Dr. Pham Samuel Kwaudonko. We are grateful for your coming. Distinguished invited guests, members of the press, ladies and gentlemen, good morning. The National Executive Council extends a warm welcome to our special guest of honor and our keynote speaker, as well as all our traditional rulers and representatives of sister associations and development partners to this important gathering. Furthermore, on behalf of the National Executive Council, I extend a warm welcome to all fellows of the GMA and to the several distinguished personalities and members of GMA here present and those who are following online. To members of the local organizing committee of the Western Division, they call themselves the Division, who are hosts for this AGC. I say kudos to you in putting this colorful package together. Furthermore, you have made it possible for many of our colleagues to have a feel of the division through the various tours organized. Once again, we are grateful to you. To our event organizer, Marwin Events, we couldn't have done this without you, and we are grateful for your support throughout the years. The theme for this year's conference is Advancing Universal Health Coverage. Who cares for the health worker? Ladies and gentlemen, for the GMA to choose this theme for the 65th AGC simply implies all is not well. Universal health coverage as a policy in Ghana is a beautiful inner garment of character, but its execution is a matter of outer circumstances and shall remain so unless deliberately executed. As health workers, it is our duty to deliver health care and services to the sick. We toil on a daily basis to provide care to the population to enjoy good health. However, the elephant in the room, and Honorable, don't be happy, I don't mean the MPP, is the multi-million-dollar question of the health worker. We are often regarded as superhuman beings and as such immune to sickness. There is always the erroneous perception that because we are in the health facilities, it grants us full access to health care. This assertion is a brutal scam, and I must say that this is a projection of neocolonial subjugation that hasn't helped our cause as health workers. Our work exposes us to the double burden of hazardous environment leading to exposure to multitude of afflictions. Our long and stressful working hours makes it nearly impossible and difficult for us to adopt healthy lifestyles in terms of our eating habits, exercises, and adequate sleep. We end up suffering from various forms of infectious and non-infectious communicable diseases. Our mental health is not spared in this ordeal. The poor working conditions and the inadequate compensation, that is why I brought Honorable Deputy Minister of Finance here. For our work, compounds the situation with financial wahala. Ladies and gentlemen, the biggest and the most important question is, who cares for the health worker? My candid answer is no one, not even ourselves. Health workers continue to pay out of pocket when we require health care, sometimes in clear contravention to what our conditions of service stipulates, of which full implementation has often become a pipe dream. We need to be protected from the workplace hazards. We need to be given a true accessible healthcare which is unambiguously free. We need to be compensated adequately for all the hazards we face. Our pensions need to be secured after we have sacrificed our bodies, minds, and souls. We need logistics and enabling environment to enable us to heal ourselves so that we can have the mental and physical well-being to be able to heal the population. Retirement on salary is not too much to ask for. There should be an immediate reinstatement of the vehicle importation tax waiver for health workers. We should not be made to pay the ultimate price of losing our lives and our homes in the quest of taking care of the vulnerable. Someone must care for the health worker. Our Lord is not in heaven, but here on planet Earth. The employer should create the environment that will give him or her the assurance that they can seek reliable health care here in Ghana rather than run abroad with the least sign of ill health. What we are asking for is not an impossibility. We are not asking for the moon to swallow the sun. Neither are we asking for immortality. To whom the bell tolls, they know. To whom the angel of death flap their wings, they know. Now to us as health workers, sadly, the hunchback peddles medicine for treatment of hunchback and yet cannot cure himself. The healer cannot heal him or herself. As health workers, and for that matter, medical doctors and dental surgeons, the question is, how do we treat our sick colleagues? We work in Kolebu Teaching Hospital, Kompano Teaching Hospital, Efian Kwanta Regional Hospital, and indeed all the hospitals across the country. Let us do a deep soul searching this minute and answer to ourselves candidly. How do we treat a fellow health worker when they find themselves in our clinics, our wards, and our hospitals? If we could all practice according to the dictates of the Hippocratic Oath, and I'll quote this portion, my colleague shall be my brother or sister, then I dare say we would have been caring for each other better, regardless of what the disabled, incapacitated, impotent, impaired, and paralyzed system does. As health workers, we are strategically placed to tilt the balance fully in our favor if we do not give up, either in judgment or execution, and if we are truly committed to our own health needs. Let us take the bold step of creating a fortune or favorable environment for ourselves in our hospitals, for it is said that fortune favors the bold. Now to the public lecture. Ladies and gentlemen, the Ghana Medical Association on the 28th of July 2023 held its 23rd annual public lecture under the theme Epidemic of Cancers in Ghana, Improving Access to Prevention, Early Detection and Treatment at the Movenpick Ambassador Hotel. The public lecture brought to the fore some pertinent issues that needs to be highlighted. In 2020, Nobacom reported 4,482 new cases of breast cancer in Ghana. This was closely followed by liver cancer, 3,452 new cases, cervical cancer, 2,797 in that order. Sadly, majority of sufferers present very late to the health facilities when attempts at cure are near impossible. Cancer is the second leading cause of death worldwide, accounting for nearly 10 million deaths in 2020. Low and middle income countries are shouldering most of the cancer burden. Potentially, there will be more cancer cases than that of TB, HIV, and malaria combined if drastic measures are not put in place to stem the tide. Notable risk factors identified for cancers include tobacco use, alcohol consumption, unhealthy diets, physical inactivity, air and chemical pollutions, and you can think of aflatoxins, arsenic, and asbestos, and some chronic infections such as HPV, hepatitis B and C viruses. Lack of accurate data on cancers due to the absence of a national population-based cancer registry and the difficulty in financing cancer care are major challenges. Despite these challenges, there is a window of hope, as about a third of cancers are preventable, another third can be cured, while the last third is amenable to palliation. Hence, with avoidance or reduction of risk factors and early detection coupled with prompt treatment, close to 70% of all cancers can be prevented or cured. Improving access to prevention, early detection, restoration of function, and palliative care are key measures for the control of cancers in Ghana. Ladies and gentlemen, for the few patients who engage the health system early, unfortunately, other factors negatively affect the outcome of their care. There are challenges in diagnosis, inadequate infrastructure, inaccessible novel cancer treatments, and lack of funding support for cancer care. This raises a lot of concern for the Ghana Medical Association. And therefore, for us, these are some of our recommendations: that there must be a continuous and sustained education to create awareness about cancers. The public must be empowered to undertake screening and vaccinations where applicable. The health facilities must be made friendly, resourced, and well-positioned to support cancer management. There is a need to train health workers to have high index of suspicion of cancers, especially among children. We need to revise the legislation, and I'm happy the NHI and then the Deputy Minister for Finance is here, such that we allow the funds for the NHI to be decoupled from the consolidated funds and then ring-fenced. Indeed, we can fight cancers if we are intentional about it. Ladies and gentlemen, now that I mentioned NHI, let me take this opportunity to congratulate the NHIS on its 20th anniversary celebrations. This is an impressive and important milestone. My only disappointment was the fact that, strikingly, in the celebration, the monumental role played by the GMA in the establishment of the NHIS was missing. And for me, I want to put on record that the GMA was the architect of the policy that birthed the NHIS. And credits must be given where it is due. So, Papa, you have to go back. Yes. Now we'll talk about Galamsey in Ghana. Ladies and gentlemen, the Ghana Medical Association have consistently raised concerns on the diagnosis of Galamsey on the health of Ghanaians. It is important to note that we are makers of ourselves, and most importantly, we are what we think and do. We are the movers and shakers of the destiny of our environment. In fact, Acting General Secretary, Yanara Yanasasi Ini. Please, shall we all be outstanding and sing this from the depths of our soul? So, say it. Say you. Say you. Now say, now never try. Say you. Say you. Say you. Thank you very much. Thank you so much. So many be you saying you. Yeah, bra. And a better. So it's up to us. Ladies and gentlemen, Galamsey has sucked us into the vortex of destruction of our environment. With heavy pollution of our water bodies, I went to Aqua Macarius, I looked at the river, and the river was as brown as the chocolate that my grandmother used to prepare. We pollute our water bodies with bio-non-degradable chemicals such as mercury and cyanide. These illegal mining activities are mainly perpetrated by people in authority, including politicians. Nana is here, but traditional leaders are part of it. Well-resourced individuals, because me and you cannot afford those bulldozers that plow into the forest to go and do those things. Even carry back obre, you can't afford. Their greed and selfishness knows no bounds. They care less about the effect of their activities on Ghana now and in the future. But this must stop, and must stop now. It is clear that today in Ghana, man is attempting to win over God by destroying in a short period the environment created by God billions of years ago. This development certainly has and shall have increasingly dire consequences. Incidents of cancers, genetic malformations, and I'm sure those of you who work in these areas will attest that, and you are seeing children with some genetic malformations that hitherto you were not seeing. And other waterborne diseases is on the rise in Ghana, especially in areas where galamsey is rife. And even for those of us who live far away from these areas, we buy the cassava, we eat the fish, we eat the farm produce from these areas, and we are also taking in the chemicals. So we are not safe. This shall continue to rise if nothing is done about the matter of illegal mining. Ladies and gentlemen, we need to exercise some dichotomy of control in this matter of galamsey. It is true, we cannot control where the gold can be found, but we can control how it is mined. We cannot allow galamsey to become a perpetual storm that stays with us, always loud and unsettling. The resolve of a few individuals to stop this canker should not be shaken. We will need to hit the highway of endeavor, and whatever stands in our way should become the way. We won't stop. The unscrupulous individuals destroying our environment through galamsey do not have an iota of desire to stop or shrink from this self-crucifixion that they have imposed onto themselves. Because whether they like it or not, they live here with us, their children live here, their grandchildren will live with us, and their great-great-grandchildren will live with us. So it's an issue of self-crucifixion. But let me say that Pope John Paul was clear in his thoughts when he said, stupidity, and I mean stupidity, is also a gift of God, but one mustn't misuse it. Let us not be afraid of them, for it is said that fear kills speedily than a bullet. We need to have a mega vicious inclination, a chastened desire to succeed in this fight against galamsey. Any form of unconscious weakness should not creep into our minds, since the body is the servant of the mind. We will be guarded by the angels of freedom, since our quest is a noble one. To all Ghanaians, we should allow reason to judge what is morally just. The enslavement of the whims of our environment through galamsey must stop. We cannot lock every door and window in this mansion of life. That is impossible. What we can do is to show resilience, determination, dedication to closing the obvious ones, and this is the illegal mining, and refuse to open the needless ones. This is how we can save our environment and secure our future. Otherwise, we have ourselves to be dictated to by the winds of life, like a ship without sail. Galamsey should be declared Ghana's greatest bête noire. Conditions of service, and I'm sure a lot of you will be wondering what is going on. Members of the GMA, ladies and gentlemen, negotiations for conditions of service still ongoing. The GMA will appreciate some urgency on the part of the Federal Wages and Salaries Commission to bring closure to this process. The GMA has been patient. However, it is worthy to note that the laborer also deserves his wages. And our patience cannot be stretched in perpetuity. Again, let me remind our employer, any delays will not be rewarded, since we will demand full implementation of any agreed terms to be effective January 2024. Even as we negotiate, the existing condition of service is still in force, and hence implementation of every aspect of the document that becomes due will be demanded by the GMA, as was done for the non-basic salary allowance. You are not clapping. Meanwhile, I must appreciate the support of the Deputy Minister of Finance, Honorable Abena Osei-Asare, who happens to be a special guest of honor. In fact, anytime we have challenges, she has ensured that it's amicably resolved. Honorable, we are grateful. We will continue to count heavily on you to successfully complete this negotiating process. So here you have to make some promises. Not promises that you can't keep. So for every promise you make, we are recording. We'll hold your hand, feet, legs, and everything to rate. Now we will have to touch on this matter of the nomenclature of medical doctors and dental surgeons. Ladies and gentlemen, especially members of the Ghana Medical Association, a lot is happening around us. And I must say that this lot tempts like a siren song. These happenings have imposed that we take a critical look at our nomenclature. The decisions we take in this regard will define our profession now and in the future. We have to be decisive in this historic discourse at the AGM tomorrow. It is important that we define who and what we are and what we want to be known for. Is it doctor of medicine or doctor of dental surgery? The responsibility to decide is ours. But remember, it is better to be seen with many than to be mad by yourself. We will not allow ourselves to be overburdened by the spirits and demons of contradiction. Ladies and gentlemen, our reputation is at stake. Now, let me blow my horn a little bit before I go and sit down. So we'll look at the achievements of my first term of office. Ladies and gentlemen, with responsibility comes accountability. I would therefore want to account for some of the achievements of the current executive committee and council under my leadership for the past 2 years. There is a saying that no one points to his or her father's house with the left hand. And also to quote the Latin words, nemo tentura sepsum accusere, which means no man can be made to accuse himself. I can confidently affirm, without any shadow of doubt, that the first term of this administration has largely been successful. Ladies and gentlemen, I am not a man of mere words, but a man of deeds. Words are just a mere wind, and one cannot eat words. We modestly managed to achieve the following with the full knowledge that the wise dwells on wisdom. We renovated the GMA house, both conferences were renovated. We constructed a perimeter wall around the GMA house. If you pass there in the night, the lighting is superb. Beautifully done. I'm sure we'll go on and repaint it and do a little more work. You see a beautiful van that is taking some of you up and down. It's under my administration that we're able to do that deal, to get that van. We signed an agreement with Trillium Industries, the producers of Verna water. And as I speak, the secretariat does not buy water. So there is free provision of water every time in the secretariat. We signed an agreement with Roche Pharmaceutical Company Limited. And for the past 2 years, they have sponsored all our public lectures. We have signed an agreement with SynLab. And for that matter, medical doctors and dental surgeons are able to access lab services at a discount of 10% for special labs and 12.5% for routine labs nationwide. So all you need to do is show your ID card and they will discount it for you. We have an agreement in place with MTN Scancom Ghana Limited to provide data and call packages, which we are still expanding. And so I'm sure tomorrow they'll be speaking to us. We implemented the constitutional amendment to allow for electronic voting by members of the association. In fact, we instituted the meeting of fellows and past presidents with the National Executive Committee, a novelty in the history of our association. And at that meeting, I saw Prof. Hesse, I saw people that I have not seen for a long time, all of them appearing. Professor Akusa, Dr. Anthony Siasare, who I suspect, if I'm not careful, I may have to advocate for defollowing or whatever, I don't know. But the point is that they were all there. Chief, I won't do it. You know I won't do it. With the help and support of Trillium Industries, we managed to distribute incubators and phototherapy machines. And some of the beneficiary facilities include Dominance SDA Hospital, which is a child facility. My own hospital, Bekwai Municipal Hospital. Efian Kwanta Regional Hospital, Dr. Tambel is here. He benefited. The Hohoi District Hospital benefited. It's in Water region. The West District Hospital also benefited. The Polyclinic in the Central region benefited. Tamale Hospital in the Northern region also benefited. And Sunyani Municipal Hospital in the Bono region also benefited. We are hoping to do more as we go. And this has never been done in the history of the GMA. Ladies and gentlemen, the issues of welfare, as you can all attest, was given special attention like never before. I am unable to recount all the achievements since it will take a whole day for us to be able to do so. However, we pray against the monsters of vanity, presumptuousness, stubbornness, fancifulness, self-indulgence, overly extravagance, so that we can even achieve more as an association. But let me tell you, we will soon release a Kraken. Who have watched the head of Medusa? Have you seen that monster? It's called a Kraken. We will soon release it by putting the GMA, we will putting up the GMA edifice with the help of all of you and the Almighty Ashiashi. Ladies and gentlemen, the GMA will be electing new executives to lead the association for the next 2 years. The election is stipulated to take place on Saturday, 11 November 2023. This election is unique in the sense that the polls will be carried out across the entire country by way of electronic voting. I would like to entreat everybody to support the electoral committee to deliver an excellent election. I want to wish all candidates the best of luck, including myself. May the best men and women emerge winners in the interest of our dear association. Whether I like it or not, my first term is ending, so I need to appreciate some people who have helped me and supported me to be able to come this far. So before I take my seat, let me extend a warm gratitude to the following individuals and organizations who have supported us and guided us through this first term. The first person I want to mention is my own wife, Henrietta De Letanto, which is in the house. She's here. Etty, you can give us a wave. Yes, she's at the back there, so she can get up and give us a wave. Yes, thank you. Sometimes it's quite scary when you have just returned from Accra and you just have to tell her that you are going back to Accra again. You have some small palpitation, you start packing your bag, You pretend as if something is amazing. She asks you what's happening. I said, oh, I have to go to Accra again. And she's endured this all these years. I'm grateful, Hetty. COP retired Dr. Ebenezer Usiemim, a fellow and past president of the association. COP, I am grateful. And he knows why I am grateful. You call him anytime, morning, afternoon, day, night, he is there to support you. Honorable Dr. Bernard Okuboy, when I call him, he pays my NHIS claims. Boss, we are grateful. Even though there are some people who are not here, I'll still mention their names because they have been very supportive. Mr. Ali Ajame, he's the marketing manager of Trillium Industries Limited. Roche Pharmaceuticals, of course, they have been very helpful. Peter Cousins Limited, if they are here, we are grateful. Director General Ghana Health Service, Dr. Patrick Kuma Abuaji. Dr. Anthony Nsiasare, Special Advisor to the President of the Republic of Ghana. Dr. Nsiasare, we are grateful. In actual fact, for those of you who don't know, during the COVID era, anytime we called him that we have a sick colleague anywhere and we need the person to be airlifted, within a few minutes, Dr. Nsiasare will make sure that the ambulance, the helicopter is ready. If you call him Monday to Sunday, night, day, anytime, he'll call you back or he'll pick up. Chief, Nyamishra, why? And until I mean to me, and the fellow no. To the Deputy Ministers of Employment, and of course, even the Substantive Minister, Honorable Genashol Bafwewa and Honorable Rekubobe, I must express our appreciation to them. Even if they cannot help you, they'll give you comforting words. Dr. Akwesi Asabre, he's also not here. He's the Director of Human Resources at MOH. The man has suffered in my hands. Edna Bafwewa, she works at the Ministry of Finance. In fact, she's virtually in charge of all the things that is pushed towards GMA, and she's always helpful. Honorable, when you go back, express our appreciation to Edna. In fact, all the pharmaceutical companies that have supported GMA over the years, the GMA National Secretariat staff, led by Frida Blanc-Semensa, I don't know whether Frida is in the room. We are grateful. All the committee members of the GMA, some of the committees have worked tirelessly hard, and tomorrow we will have the strategic policy document also being launched. And you saw the face of Dr. Rita Larsen-Randolph yesterday when she sat here. She was tired. This process has taken a toll on her. We are grateful, Rita. In fact, Rita is my sister, for those of you who don't know. And so immediately I leave, she will leave all the things she's doing for GMA. And let me make a special mention of my good friend. In fact, the special guest of honor for this occasion, Honorable Abna Osayasare. Honorable Nyamishira Wati. The unfortunate thing is that when I met her, I was married. And when she met me, she was married. So nothing could happen. I must admit, the list is not exhaustive enough. But for all those who have contributed in diverse ways, including my family, my friends, to make my tenure as president of the GMA success, I say a big thank you to you. The fellows of the GMA, past presidents, National Executive Council members, and of course, members of the GMA, and all the invited guests here, ladies and gentlemen, the media or the press, once again, let me express my profound gratitude to all of you for the support and for you being here. Thank you. May the good Lord bless us all. Come on, let's do it better. Let's do it better. We heard from the preaching angels and demons to the promises
and all the great achievements that were done. And we are very, very grateful, Mr. President. If it wasn't today, I did not know our president could preach. So, President, we are forming a church. This medical profession is not bringing money like that. And please, I just want one position in that church. Please, do you know it? Treasurer. Now, I saw no pacho. Treasurer, the kind of kind of please, let's respect ourselves. And no. Simple one. So I think at this juncture, I saw President do a very beautiful thing. If you watch the court proceedings, the Kumasi Makola, was it Asomnegong? So the next speaker, there's Asomnegong on you. You are supposed to make promises, and we are listing them. Victoria, you have the sheet ready.
Very ready. And
the pen. We are listing them. One promise, no, in fact, 1 minute, one promise. That's the number. Please, so if you know you are not ready, please, we can give you a bit more time. And your promises must be thick.
Okay, yes. So before our special guest of honor comes, we want to introduce Farm Emmanuel Zeka. He's the chairman of the Pharmaceutical Society, Ghana, Western Region. Thank you very much. We also want to acknowledge the presence of the rep of the Municipal Chief Executive of Sekondi Takoradi Municipal Assembly, Mr. Francis Kofi Mensah. Okay, all right. So at this point, yes. So we call on our special guest of honor, the Honorable Abena Osei Asari, Deputy Minister of Finance, MP for Etiwa East, to give us her word.
Please let the applause be loud. But the number of promises that are coming, let it be loud. Keep clapping until she comes. Keep clapping, keep clapping, keep clapping, keep clapping, keep clapping. If she doesn't promise enough, she must clap for every single person who has clapped. Keep clapping, keep clapping.
I'm in trouble today. The chairman and president of GMA, I'm in trouble today. But I know I have a lot of friends here who bail me out. Nana Kwabena Nketia the Fifth, the Omahin of Esikado, also known as British Sekondi, and the keynote speaker for this August occasion. I got to know you a few minutes ago, but it's like I've known you forever. The regional minister and member of parliament for Takoradi, Honorable Kobe Ochre Dako. The president and chairman of the Ghana Medical Association, Dr. Frank Sribo. The presidential advisor on health, Dr. Insia Asare. The CEO of National Health Insurance Authority, Dr. Okuboy, and also a brother. The Western Division President of the GMA, Dr. Kofi Owusu. And the Deputy Director, CHAG, Western Region, Dr. Gifty Amugi, who also happens to be my roommate when we were in Wesley Girls. Our traditional and religious leaders, members of Ghana Medical Association, distinguished participants, ladies and gentlemen. Allow me to extend a warm Ghanaian greeting to each and every one of us here. It is with deep gratitude and a sense of honor that I find myself among you today, not just as your special guest of honor, but also as a fellow advocate for healthcare excellence. Our gathering today under the theme, Advancing Universal Health Coverage, Who Cares for the Health Worker, reflects our collective commitment to both the well-being of our healthcare professionals and the advancement of healthcare in Ghana. As we delve into the heart of this crucial theme, I'd like to take a moment to acknowledge the profound and harmonious relationship that I have enjoyed with the Ghana Medical Association and its esteemed members. This relationship is founded on a bedrock of mutual respect, trust, and a shared dedication to the welfare of our healthcare workforce. I extend my heartfelt congratulations to the GMA on the celebration of your remarkable 65th anniversary. The GMA's journey, which commenced in January 1958, is a testament to the strength that arises from unity and a shared vision. Today, we stand together 65 years later in profound appreciation of the impactful and selfless service that GMA has rendered to our nation. Our chosen theme, advancing universal health coverage. Who cares for the health worker goes beyond the realm of policy. It resonates with our collective conscience and underscores the importance of recognizing and honoring the individuals who stand at the forefront of healthcare delivery, our esteemed health workers. In our pursuit of universal health coverage, it is imperative that we remember that our healthcare professionals are the very bedrock upon which our healthcare system rests. They are the heart and soul of our healthcare infrastructure, working tirelessly to ensure that every Ghanaian has access to quality healthcare. Over the years, we have witnessed remarkable progress in key health indicators. Ghanaians are enjoying longer, healthier lives, with life expectancy soaring from 56.9 years in 1999 to an impressive 63.8 years in 2021. More children are surviving beyond their 5th birthday. Mothers are experiencing safer childbirths, and the scourge of communicable diseases has receded significantly. These achievements stand as a testament to the unwavering dedication of our healthcare professionals and their commitment to the welfare of our people. Under the steadfast leadership of His Excellency Nana Addo Dankwa Akufo-Addo, our government remains resolute in its commitment to build upon these accomplishments, fully aware that the journey towards universal healthcare coverage is an ongoing endeavor. We have made substantial investments in healthcare infrastructure, education, and the provision of essential resources for our dedicated health workers. Initiatives like free specialist postgraduate medical training, hospital expansions, and support for nurses who bolstered our healthcare system. We have invested in healthcare infrastructure and services. Nana says I shouldn't mention Agenda 111, but that is a fact. We have invested in healthcare infrastructure, including the Agenda 111, emphasizing the importance of primary healthcare. These investments have yielded positive health outcomes, with life expectancy rising and maternal mortality rates improving. Our commitment to healthcare professionals is evident in the bespoke conditions of service and the provision of essential resources that we continue to give to our healthcare professionals. I think we deserve a clap for this. In the context of our theme, who cares for the health worker, it is imperative to stress that the government of Nana Addo Dankwa Akufo-Addo holds a profound and unwavering commitment to the well-being of our healthcare professionals. Their welfare is not just a mere policy objective, it is deeply ingrained conviction. The recent challenges faced by health workers during the COVID-19 pandemic served as a powerful reminder of their unwavering dedication and resilience. In response, government made substantial investments in personal protective equipment, allowances, insurance, and public education to support our frontline heroes. To each and every health worker, I extend my heartfelt gratitude for your selfless dedication in safeguarding our nation's health and well-being. I think you deserve a clap. While recent macroeconomic challenges have affected our nation, including our healthcare professionals, I'm pleased to report that we are now witnessing signs of economic stability, which place optimism on the horizon. in the forthcoming 2024 budget statement, which is set to be delivered on Wednesday, the 15th of November, 2023. The government will outline our policy approach to further enhance economic stability and restore the purchasing power of our citizens. This will not only benefit our healthcare professionals, but all Ghanaians. In parallel, our commitment to improving the conditions of our medical practitioners remains steadfast. We are actively engaged in discussions surrounding the conditions of service, and we know that progress have been made, and very soon we'll be signing the agreements moving forward. So the chairman and president of GMA, I just want to assure you that we have made some progress, and very soon Fair Wages and Salaries Commission will be calling a meeting to kickstart the operationalization or the finalization of your new conditions of service. And like I said, your conditions of service is bespoke to the GMA. We have been able to do it for the past 7 years, and I know this year will not be an exception. Admittedly, our pledge to offer exemptions for the importation of vehicles for doctors have delayed. This was largely due to the efforts to comprehensively streamline our exemptions regime. Thankfully, Parliament passed the exemptions bill last year, and we are now repositioned to engage or in an engagement that we believe will manifest in this important pledge to ease the transportation burden of our doctors, to also help them deliver quality and timely healthcare. Is it that we didn't hear, or you want me to repeat what I said concerning the exemptions? I said that truly we have delayed in the passage of the pledge we made to offer exemptions to our medical doctors. And all this while we were looking at streamlining our exemptions bill. It has been done. And so we believe that this is the right time to engage, to make sure we redeem that pledge that we made to our medical doctors. Ladies and gentlemen, we stand at a crucial juncture where the future holds boundless possibilities for us. Our partnership is grounded in mutual respect, trust, and accountability. Together, we have demonstrated our ability to achieve more when we work hand in hand. As we embark on this conference, let us remember that our healthcare professionals are the lifeblood of our healthcare system. Their welfare is pivotal to the strength of our healthcare delivery, and we will continue to care for those who care for us and collaboratively work toward a healthier and more equitable future for all. We will continue to address the issue with Galamsey and all the pertinent issues that continue to affect our healthcare delivery and the nation as a whole. So in conclusion, I extend my profound gratitude for the privilege of addressing this esteemed gathering today. Together, let us explore the depths of our theme, advancing universal healthcare coverage, who cares for the health worker, and collectively illuminate the path toward a healthier, happier, and more prosperous future for our beloved country. Long live GMA, long live the Western region, long live Ghana. Thank you, and may God bless us all.
The way the applause is coming. Please, this one, I need to run a poll. Please, promise is not by, you know, Muhun is saying. Please, when you take the history of presenting complaint of this promise, what were your findings? I think we have to ask some direct questions to have more clarity. The differentials are just two. It's not like that. But bespoke there, the woman got vibes, you know, got vibes. Honorable Kubo is sharing some experience. The man is very experienced. He said in his very professionally romantic life, he has learned from scientific evidence that the women don't make many promises, but they can deliver many deliverables. You know, that is why they can have one action and give you triplets. So we should believe that these few promises will lead to quintuplet deliveries, multiple ones. So we believe you. And therefore, as I've also become a pastor because the president has said, shall we all say amen? Now, Honorable Yaka, amen, Yerina Amma. It wasn't me. It wasn't me. This sounds like a Pastor Mama Pat moment. You know, one moment I was on this side. I did more prayers for my president. President, and you know, we would like to acknowledge the presence of some important persons again in our midst. Professor Alfred Yorson is here. He's a trainer and he's the dean of the University of Ghana Medical School. Professor Frank Edwin is also here. He's the dean of the UHAS. Once he has stepped out and the wife is here, the two of you want to promise that you are one. So you are also here. And the wife is also Dr. Amma Edwin, also a trainer as well. Dr. Frank Osu-Setre, who is the director of medical affairs, Korle Bu Teaching Hospital, is also here. A lot of people don't know him when you call his real name. But when you mention the other one, Ko, then people know. Okay, so we'll take a quick musical interlude from the cultural troupe so that we can shake ourselves up a little, you know, so that we can get healthy. You know, we've been sitting for long. So the cultural troupe, if you are ready. Wow, 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 wow. My co-MC was just telling me she used to be doing this some time ago. I didn't believe it. Are you sure you were doing this thing in
Oh, I have a lot of witnesses.
Jehovah Witnesses?
No,
Jehovah Witnesses.
no, Francis is my witness.
Francis. So only one person knows how you do it.
He is the whole force.
The thing is, you took him to the altar and committed the man. So he can never deny that he doesn't know. So you will give it to you. You are also one. Afterwards, we'll play the drums for you. Take it over.
Okay, thank you very much. So, ladies and gentlemen, we are at the peak of our ceremony, and we are going to have our next presenter being a fearless man of our time. He's expressive and he's a force to reckon with. He's a hero and he's not afraid to speak. Ladies and gentlemen, help us welcome the keynote speaker of this August conference, Nana Kobna Nketia IV, Omahene of the Faith, Omahene of Esikado traditional area, Takrade.
Shall we be upstanding, please, as Nana comes? Yes.
I think some very beautiful protocols were made this morning. And since Dr. Nsiah-Sarwey knows that I'm not good at those things, so good afternoon. After where your boss took you to, Dr. Srebo, I don't know if I can take you higher, but that is one of the best speeches I've ever heard in my life. You know, we men tend to talk about side chicks. And I was trying to get gender balance, try to get the deputy finance minister to be a side guy. But that speech was so good that it broke up the attempt. But I'm yet to continue. The MC has also raised a lot of things around me which aren't true. Please, as we go, you realize that they're not true. One of the things that I noticed when I walked in, and I was nicely corrected, and I think that I should share the wisdom of the correction with you. I looked around and said, Nigeria is who MPP colors were. Then I was told that that is your colors. So thank you. Clap for yourselves. My personal experience was that one of the days that I was receiving a member of the most oppressive family in the world, those who came to call yourself your masters, they put some buntings in my place, which was highly unusual anyway. But as I was walking in, one of the nice ladies walked up to me. Nana, somebody came in and said, let me say it in Fante, you know. I would have said it in a Hunter, but most of you wouldn't understand. I said, Nana, Bakata was the MPP colors I had. And that was the British colors in honor of the British visitor. I'm glad it. And you know how I talk. I'll be away Jim no Bakata British colors. Or your MPP colors. It wasn't an MPP thing. So why that you come and see these colors? You know, and that's where I share with Bishop Palmer Buckle that we must have a social space within our existence and not take everywhere you go that it's NPP or it's NDC. Or may in jail. Awolai Atibrukusu, who used to be the national vice president of the House of Chiefs, as a terror, asked permission to go because he has to go and do something at the House of Chiefs. So he didn't leave He said, "Now what would the doctor say?" So in case he walks into your place, don't dissect him too much. He can. Now, I also heard that this is the 65th conference you are having. Now, in our numerology, this is, properly speaking, the 4th conference you are having. 6 plus 5 is what? 11, yeah. But this is the 4th, and in 4th, there's wisdom. And when I was coming, I saw pictures of me so many years ago. I'm sure you put it there. You look like a bad boy. And the pictures that I saw of me, what surprised me was I look so young. Madam, if you had seen me that time, I'm sure the side guy chair would have worked. But I'm so happy to be here to see some of my old friends, very old friends like Professor Hesse. You know, we were in the University of Commonwealth together. I didn't say University of Ghana, University of Commonwealth, which was in Legon. And so the young man knew me before I became a serious guy. And if he tells you the things I used to do in Commonwealth, I won't be on this too. I'm also happy to see Dr. Okoboy. He's one of the few TV stars that I know, and he's always in a bow tie. My joy today is that the bow tie is made of Ghana cloth. Thank you very much for wearing that one. Dr. Nsiasare, you know, this is the presidential advisor. You are paying attention to the finance minister, but this is the presidential advisor. We made our negotiations before we came here, so I wouldn't say anything. You know, we talked. And I was with him in Kumasi, in Accra for a conference that was going on. Unfortunately, I missed the speech, and I've missed the speech today too, Doc. But tonight, he says he wants us to sit and share some stories to do with Sekendi Takoradi, and we shall. God will make sure that we do. When the MC who was talking, Salovey was talking, the way things they said about stupidity and so on. You know, we become so stupid that when somebody does something with common sense, we tend to applaud the person. There was a guy in Zambia who decided not to buy V8 and so on and so forth. He was on social media. What he was doing was simply common sense. And you don't applaud him. But when you are doing stupid things, then you think twice about the people who do it. You know, I don't want to go far because somebody says that I'm going to boom. How can the chief boom? So that's it. But thank you very much for getting us to stand up and sing Inara and Asa singing. There are certain songs that when you listen to, it evokes something in you, sometimes tears. And I remember discussing it with one of the people who are at the center of our independence struggle. And I asked him, why didn't we choose this song as our national anthem? Because I mean, I like singing in Kosikelele, Africa, and so on. Then he said something that I cannot tell you. But after that, I'll tell him for certain reasons. But you know, we are here, not because of doctors. We are here not because of your salary. We are here because of Ghana and Africa. For a while now, I've been enjoying, there's something that I wanted to say about my side chick who wouldn't agree. Madam, should I say it here? Okay, for a while now, I've been enjoying a particular path. That's a very beautiful saying that I found. He says, of all the roads you could ever travel on, I think the journey back to finding yourself is the most magical one. It's so interesting, and I always meditate on that statement. In that frame of thought, a gentleman, I don't know if he's here. One of the people who stands on my magical path, always differentially inspiring me to revel in that magic, is Dr. Boatin. Is he here? He's not here. He has fled. He has dodged. He walked in one day with Dr. Sribu and so on about my being here. I had a lot of misgivings about coming here. First, this disturbs my stream of consciousness. In fact, if you've been listening to what is happening in West Asia, I don't know why we call it Middle East. Middle of whose East? If you don't define your globe, somebody else will define it for you and force you to go according. It's West Asia. So if you listen, they are talking about ceasefires and a pause. I don't know which one is the pause and which one is the ceasefire. But you see, euphemisms, they work every place. So, and if you notice, when I've been talking, I don't use the royal we because of ego problems about this. So if you blame me, you don't blame the stool I sit on. So talking to healers, and I call you healers, about universal health coverage is really out of my depths. So being here, I know that I am in trouble. In order to try to solve my problems, I went for ChatGPT. See, you even know it better for me. So I said, oh, this one, they say we are moving into the evolution is going on, so machines will think for us. I went and what they brought out, if I bring them here, I'll develop more gray hairs. So please, if I say anything untoward, blame Dr. Boatin. Don't blame me, because really this place isn't meant for me. But you see, the reason why I always give him that respect, and I'm sure that many years ago, he was a married man, he still is. He's a father and he's a doctor. And yet he found time in the dead of the night to go with me to a village to attend to an elderly sick person. It is an act that always, anytime I see him, it motivates me towards humanity. He used his time, he used his vehicle, he used his petrol, and he used his knowledge for us to go to a particular village to see somebody who was having urine retention, and so they called me in the night just because I made that request. I know I can never repay him for that magic service. Seeing your topic, universal, also drew my mind to the universe. I said, hey, Ghana doctors, they are still talking about universal. We are now in the metaverse, you know? And even with the phone, we are talking about 5Gs and so on and so forth. So we are in the 5th dimension. And I asked myself, why are these people bringing me? I want to go to the 7th dimension. And yet they are bringing me down from the self-knowledge thing. Anyway, being conscious of myself as an African and listen to the cosmos. A lot of us don't take time to listen to the cosmos, which through songs, through dreams, through numbers, through animals, through rivers, plants, it's always whispering messages. And I wonder if all of us here are in the same dimension. Obviously, listen to people talk and seeing things. Some of us are caught up in different dimensions, even though we think we are on the same plane. Some are caught up in the dimension of narcissism and insatiable greed. Some are caught in the world of hate. Some are caught in the dimensions of love and compassion, like I had for the potential side chick. Some are caught in the ambition for hegemony. In fact, there's a perspective held somewhere that if you look at human behavior, you see all forms of animal spirits there. Some are like snakes carrying fangs. They will bite you while they are saying one thing. So look at it and enjoy it, you know. Don't think that the cobras and so on are only in the bush. They are among you. Anyway, but it's, whichever way it is, it's an interesting cosmos. And I'm really happy to be alive and to be here. Sometimes when I was coming, I heard some young people singing on the road. And they're singing a song most of you know as a song that when I die, and if I am a Christian, they will sing it before they take me to the grave. And that is Lead Candle Light in brass band. And I told the young man who was bringing me, this song has awakened a certain feeling in me. So when the superintendent for medical, you spoke first, am I right? And he was doing his union things. I was there so happy, you know, because that song, Lead Candle Light, was when they decided that they would go on a strike to ask for freedom for this country. The only priest who went to prison, called Reverend Father Sefa, stood up and started singing that song. That is why the unions have that song and they sing it. So that is the underlying thing, Lead Candle Light. Anytime they hear the song, don't think about death, think about life and those who are at the forefront of the struggle. But that also takes me to the small place that I come from, called the Escado, derelict houses, a fragile culture, and a preponderance of unemployed youth who are also compelled by the prevailing economic quandary and absence of opportunities to aspire to risk their lives to face the challenges of the Sahara, North Africa, and enter Europe for a pseudo-slavery existence on farms and clean toilets and offices. I then asked myself, did those who asked us to be free, is this what they wanted us to be? And it hits my mind. The reason why I'm saying this is you are the doctors. And one of the things that you don't talk about is that we are suffering from intergenerational trauma. And now you're going to treat that, I leave it to you. You know, if you're able to treat it, there's something I'm going to ask the Deputy Finance Minister to do. That reminds me, why is it that whenever we have anything, women are treasures and so on, but at the ministry, so making her the minister and making the man the deputy. Madam, I'm going to canvass for women, so you'll be there. You know, but the sentiments of the youth remind me, and you remember that I sang that song, was it today? Them belly full, but we're hungry. A hungry mob is an angry mob. That's Bob Marley, yeah? Sometimes listen to him for inspiration. His songs are filled with wisdom, you know? But as an African, sit down and think. When you hear your president was talking about Galamsey, you ask yourself, just ask yourself, what are our values? Do you have any values? Anytime I'm crossing the prayer, I pray. If there's a God, help us. Because how can you kill yourself? And you know that what you're doing is going to kill you. It's going to kill the nation. And then what do you do with it? And yet, we have him here, we have him there, they're all in uniform. You have the, oh, where's the RM? Oh, he's there. We have the RM, they're holding power and so on. And we can't stop this thing. And maybe a Yetsu. Where lies our values? And if the doctors don't give us our values, you're not able to prescribe our values, then what is your profession for? Correct our heads first. If our heads are not corrected, the symptoms, you keep on treating them. My hero, of my heroes in the world, is a doctor. You all know him. I wear his t-shirts, Che Guevara. I believe that I'm the only chief in Ghana who wears Che's t-shirts, El Comandante. Of course, you can then balance him with the horrible man from Haiti, Papa Doc Duvalier. But I went to Bolivia once, and I met one of their ministers. And let me tell you how the minister was traveling. He was in a taxi, the Chohe Matashi, you know, push and go. And the minister was in just plain white shirt. So when we finished meeting, then I went into my revolutionary talk. I said, but you people killed Che. And he said something to me. He said, yeah, we killed Che. but he told us that he will come back in thousands. And so I asked the minister that, have you heard of Nehanda? Nehanda was a Shona priestess who fought to get the British out of Zimbabwe. And when they got her and they were going to hang her, she says, yes, hang me, I'm pregnant. And as soon as you hang me, more of me will come out. Let's see more of doctors like Shea in Ghana. We are yet to see that. Don't be comfortable in certain zones. Come out. And that's why I say that if doctors cannot save Ghana, who else? So please, this is just to you. Both of us, I read history and we all share certain things together. I'm also a doctor in a way. What do we share together? Anytime you want to diagnose something, you are doing history. So we share. If I'm talking, I'm going into history in order to come out with the lessons that I've learned and try to treat the symptoms today. Of course, I don't forecast. But the same thing, if you don't go into the history of the problem that has been presented before you, you can't do anything. In fact, when you were talking, when I talked about Reverend Father Sefa, who was from Asukore in Asante, but lived in Escado. He was the Escado Methodist priest, Anglican priest. In 1962, he walked into a doctor's, he had queued up to see a doctor, and they brought a woman who was virtually going off. And all of them stood aside and rushed her into the doctor's, what do they call those? Your offices, your consulting room. And the doctor shouted that, no, get out, I was there to bring you in. The story I heard was that Sefa left his place in the queue. This is one of the most important people who went to prison for this country. And the conditions at prison, I don't want to tell them. His daughter died, etc. But then he went there to the doctor, and I hear he slapped him and said, do you think this is what we struggled for to bring into this country? And then he walked out, he forgot his sickness. So there's an attitude. And that's why I asked, don't treat the symptoms, go to the core and bring some of these things out. And just like I'm saying, if you don't treat the head, we elect people to come and serve us. We go and stand on the roadside and we shout, yay. Something don't scatter. In fact, the RM has done very well because he knew you were coming. So the roads in certain parts, they fill the potholes. But you see, I deliberately brought that out. We go through potholes, but let the president or the vice president come. Before they come, they'll fix the roads. And you ask yourself, are they more important than me, the one who pays tax? Then there's something wrong with my head. And meanwhile, he writes in a free car, free petrol, but I have to pay for my shock absorbers and so on and so forth. There is something wrong with our heads. There is a linguist staff that I love, but it's also a drum. And when, Salome, he's run away, yeah? When Salome was talking, he had the drums and he said culture. Culture is not the drums. Culture is psychology. But the beauty about it is that that drum is a drum that Osun Kokroko, no man kitadua. The elephant is big. It can do all kinds of things. But the Oman, it's in the hands of the royal antelope. And if you Google the royal antelope, it is the smallest of all the antelopes. And that is where the power lies, in the thoughts, not in. So there's a lot of wisdom in these things. And I'm praying that GMA, in the wisdom of Sekendi Takoradi, is going to come out with some of these things. After all, take Cuba. We go to Cuba for healthcare. What do they have in Cuba apart from our here? What do they have? Go to the primary schools. Ask them, what does Ghana have? You name them: cocoa, bauxite, manganese. I don't want to talk about gold, and so on, oil. And then you have to go to Cuba, which has only Aguirre. Then there's something wrong where I didn't say so, you said so. So that is the challenge that we have. How do we get all these things working for us? Coming back to the Galamsey and the environment, you know, our ancestors had the forest and so on as their pharmacopoeia. That's where they found everything to treat us. Why should we deliberately destroy this pharmacopoeia? In whose interest? And in what interest? That's why I say that sometimes it's like we need to go to anchor for all of us. Sometimes, you know. So this is the problem. And I just came with Dr. Nsiasare. We were both at the plant medicine thing. And I'm praying that there's going to be a committee that is going to be set up to look at how to incorporate things. Because if you do not own your own health services and you let some other people control your health services in terms of pharmacy, in terms of treatment, and so on and so forth, believe me, you'll never get anywhere. Your health services must be self-reliant. And there are things that I've mused before, but here maybe I should say it publicly. Anybody who picks up a public appointment must also sign that he or she is not going to be treated outside Ghana. If the Ghana Medical Services cannot treat you, fix it. Then what are you there for? So that is the challenge. People get sick and they have the luxury of being sent to the best wherever. But those in public services, see, I didn't say anybody, those in public services, most especially those who call themselves politicians with public appointments, they should sign an undertaking that anything to do with their health, they will stay in Ghana. Now, the effective COVID, sorry, I've just messed something up. When I saw the word universal, I said so, but then I realized that the universal was actually national. And so I breathed softly. Going on to that, I was also happy the vet doctor came to speak, because that also tells you that we live in a holistic world. And we should never forget it. Everything around us, you say, I'm an African. Everything around us is important to us. You know, so these are small things that should come together to work. Now, let me jump so that, because the young man's speech, I'll never get there. And one of the best things I've ever taken part in at the Regional House of Chiefs was the coming of the National Health Insurance Scheme under the Kufuor administration. Of all the regions in Ghana, at that time we were 10. We were the only region that the chiefs met to endorse. When Parliament was, they were playing politics with it. We met and said, as the president, that please go ahead and do it. It's in our overall interest. Because you measure a country's development by the dignity of its given to the human beings. And there are two major things. One is the dignity you give to your woman. If your women become prostitutes and so on, the country is gone. Women carry the nation. But secondly, the health of the people. And you look at it, if you're sick, you're this, no. And that is why I enjoy Cuba, for the attention they've paid to the health services. And we, unfortunately, haven't been able to do so. So I pray that Dr. Nsiasari will go back to the president and said, what can we do with the Cuban model? That should we emulate it and even make it better? But I'll leave that to him. That's my humble village suggestion, you know. But the NHIS seems to be having all forms of problems. And sometimes you ask yourself, why? In fact, those who know me know perfectly well that I will die for this nation, but I'll never die for a private organization. My nation, my state comes first. State insurance, for example, was started in Escado by Yamite and Anthony Kobna Wood. Now we've allowed it to go to the docs. And yet, out of it, we can even have NHIS separate, that everybody pays to it in the name of the state. It becomes mandatory. We need an insurance company that looks after NHIS, separate from everything. No private person should, or no private enterprise should collect the money for the NHIS. We need to look at some of these things. See, when people talk about private, let's privatize the army. You know, we talk about these things without thinking. I've worked for people before. And one day, one man came and says, see this Rolls Royce, the work you do, it bought me this thing here. I looked at the guy upside down, said, why, Joe? But the state, this is the one I wear a uniform and die for. And the NHIS should have something distinct so that we can all walk in there and know that a doctor is going to give us the very, very best of treatment, the best that the nation can afford. So please think about it. At the same time, too, doctors have a savior complex, and I don't blame you. Anytime you see a doctor, you're going to have salvation. So when you start your church, Dr. Solomon says you collect the money. Me, I don't want the money. I want to be in charge of gender relations. That's where the fringe benefits are. But on the more serious side, ask almost any child, and they'll tell you, oh, what do you want to be when you're a little boy? Or, I mean, when you grow up, I want to be a doctor, and so on and so forth. There are very few professions people want to be. There's a boy who was asked in the school, what do you want to be? After a few people, he says, oh, I want to follow the footsteps of my father. So the teacher asked him, and what do you want to be? He says, oh, I want to be a policeman. And the teacher said, is your father a policeman? He said, no, my father is a thief. But doctors, unfortunately, are seen in the frame of the savior complex. As soon as you have a good doctor, and even comes and smiles at you, treats you in a certain way, about half what you are complaining about is gone. And so that is the mandate you have. And that is why I said that if you don't, and I enjoyed your speech, honestly, even though you were campaigning for yourself, but I enjoyed your speech. You know, and I didn't know that you are going to put chains around your neck. Africans like chains too much. Every time they are wearing chains, you know. So, but I did, and that is your role. The angels and the demons always take the role of the angels and come out and speak for the nation, but without fear. Me, I can do it because Professor Hesse is here. He knows who I am. I have very little time left in this world. It's Bibi Odamuke Biamaka. But this one is young, and it is role that you say these kind of things. You know, don't divorce health insurance from every other thing that you'll be working. There's a philosophy that I came across quite recently. It is called Luciferism. And the person that I heard, Charles Templeton, when you have time, just browse it. But know that we are human beings. So we won't go in the Luciferism. And I hope that doctors will take that thing. Now, of course, I can't come and stand here and not talk about the infrastructure of our hospitals. Madam, I promised I won't go there. But it is your role that you should look at. You should look after the hospitals. That's where you work, the whole hospital, the atmosphere, the gardens, whatever it is. If I come to the hospital and it's not looking good enough, I'm not going to blame the government. I'll blame the workers in there, the doctors in there. If you go in there and there's corruption, don't blame the government. It is the workers working in there. So whenever I see Korle Bu, I ask, and their doctors, don't they have a board? Don't they have it? If you have it, blame the board. You know, agitate that they remove them and put people like me there. I won't collect any money. Look, there are things I was telling Madam. At a point, I had 4 containers at different points of hospital material and donated to the various hospitals here. 4 40-foot containers. The saddest part is that I couldn't get government, the waivers. So in one, I even had to pay demurrage and so on and so forth. But I didn't want it. Now I've stopped. See, the reason why I'm saying this is that find ways and means of making sure that something like that is not abused. And those who want to send in those things, Escado had an ambulance. If your Kwanta had an ambulance, I paid for the Escado one, the tax. These are things, I hate singing my song in public. The city council paid for the Effiam Kwanta one. The day they sold the Effiam Kwanta one, they didn't even have the courtesy of picking up a phone. No, we are selling the ambulance, we are selling it for private use. And yet it was brought all the way from Auckland to Ghana. So find ways and means of putting accountability on some of these things that are done. Because I mean, I can't go in there. If I'd even dental thing, I gave an X-ray, brand new X-ray machine to Escado, gave a brand new X-ray machine to Takoradi Hospital, right? And then the other one that, if they don't do it well, you die quickly. The oxygen thing when they do the, you know, and so on and so forth. I don't want to go into details about some of these things. And the beauty about the X-ray thing was that the person who sent it to me, Dr. Rory, died before I could say thank you. He was gone. And he says, and the children called, they said they've done their duty to Africa. And I was very happy. But even those ones, I pay duty. So find a way of making sure that those who sincerely want to come and help, sincerely, they get their waivers through the government. It's absolutely necessary. I know it's abused, but think about some of these things. And I'm sorry that I'm blowing my horn. I don't like talking about, oh, I did this, I did that. The other thing that I love saying is that I used to play football. I think we've talked too much today. So I'm jumping to some of the things that are here. One of the things that I had, the ideas I had, I've been very fortunate of serving during Atta Mills' time on serving on the Public Emoluments Committee. And I sometimes ask myself, but why aren't doctors here? Just imagine the category of workers who are there. I don't want to go into details, but I think that if we retain that article, doctors must be moved in there for you, for your benefits and emoluments to be considered. I also found out that you were giving some awards today. It's unfortunate that my roommate is not part of this. Hesse, you remember him, don't you? Oh, he's received this. Niboy. Okay, Niboy Tegum. That was my roommate. He was as skinny as a spider, and I was as strong as. Oh, thank you. Well, that's when I said, but I'm just happy about this because there must be a national award scheme that the teachers have it, the nurses have it, and so on. But doctors, you need it. I know you're doing your own little awards, but you need it, a national award scheme. And you'll see that some of us who don't have money to donate cars, you might even bring bicycles. So think about it. Let's set it up and make sure that some of these things are done. And in 1 year, we glorify you, you know, for the work you've done. I'm also thanking you very much that Dr. Hussein and so on, that most of you are not wearing suits here, like Okoboy. Whenever I wear a cloth and go to a place with people wearing suits, I even find it difficult to speak my small English, you know. But in your work, it is the work everybody must aspire to. That's, they give us education, not for ourselves, but for us to use the education to uplift the communities and the societies we are in. If you're a doctor and you can't lead the struggle to uplift the country, then you're also failing in your profession. Let me ask those of you who have been fortunate to receive the GMA Bible, this Bible. Do you have it? Okay, please open to page 11. I'm sure you've seen what is in page 11. Okay, so let us forget the first sentence and go to the second, third, and fourth. And after, I'll go and sit down. I solemnly pledge. Please, let's say it together. I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patients will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit considerations of age, disease, or disability, creed, or ethnic origin, gender, or nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me, even after the patient has died. Great. And as I read this, I asked myself, if the Ghanaian doctor were in Gaza, would he run away? Would he stay? Thank you very much. Very comfortable.
Shall we do it better for Nana? Let's keep the applause coming. Thank you so much. Please resume your seats. Thank you, Nana. From the mental health side of things to the infrastructure, all the way to the human development, he touched on all this in his own witty way to draw our attention to the critical issues that needs to be done, all the way to the financial waivers for things that people bring in to help the healthcare sector. Thank you very much, Nana, once again. We've come to a very important segment which has to do with the association recognizing the efforts and the time and the tireless sacrifices some members have put in. We all put in various degrees of effort, but the association finds it necessary to confer some awards on very important personalities that have played key roles over the years for the association. And we'll be conferring 2 sets of awards, the Commendation Awards, and then the highest award possible in this association, which is the Fellowship Awards.
Yes, please. To do this, we call on Dr. Na Jama Glover to take us through the Fellowship and Commendation Award session. Please, Dr. Na Jama Glover, you're welcome.
Shall we receive a round of applause?
Good afternoon. We begin with the commendations. These commendations are to colleagues, senior colleagues who have served the association in outstanding ways and would like to call them up to come and receive their awards. We call Dr. Ibrahim Baba Mahama. He served as the divisional chair of the Northern Division for 16 years, another 4 years as vice chair. He's been a member of council and has served on various committees. We call Honorable Abna Osei Asari to please present this award on our behalf. Thank you. Thank you very much, Dr. Mahama, for your service to the association. Honorable, please, if you will indulge us, we'll call a few more to come up, please. We call on Dr. Thomas Affo, Dr. Thomas Mensah Affo. He was the divisional chair of the Upper East Division. He served on council, and today we would want to acknowledge his hard work to the association. Thank you very much, Dr. Affo. Would like to call Dr. Richard Anthony. Dr. Richard Anthony, Divisional Chair of the Western Division, member of council, and has served on various committees for the GMA. Thank you very much for your service. Now I would like to please call Dr. Anthony Ashinyo. He served for 7 years as the divisional chair of the Volta Division. He's also been a member of the council. Thank you very much for your service to the association. Last but not the least, we award Dr. Abdullahi Abukari. He is not able to be here today, but he's nominated Dr. Barihama Adam, MedSoup of Bembela, Government Hospital, to take the award on his behalf. Thank you very much for your service to the association. And thank you, Honorable, for presenting the awards. Now we go on to the award of fellows. Can I please call Dr. John Emmanuel Williams? Please, let's applaud him as he comes up. Citation in honor of Dr. John Emmanuel Williams. You were born on 25th May 1963 in Accra and began your basic education in Sogakope in the Volta region in 1968, transferring to Sakasaka Primary School in Tamale and finally completing in Kumasi. You were admitted to the now 8-time National Science and Maths Quiz Winners School, POSEC, where you completed your ordinary level in 1979, and then to Prempeh College to complete your advanced level in 1981. You obtained your Bachelor of Medicine and Bachelor of Surgery in 1985 from the Kwame Nkrumah University of Science and Technology, passing out as the best student in your class in that year. You worked at the Konfanoche Teaching Hospital until the late 2000s, when you were posted to the Sunyani Hospital, where you were the medical officer in charge of the tuberculosis clinic and the regional resource person for the acute respiratory infections program, You are trained regional trainer for the National HIV STI Control Program and have worked as a clinical research fellow at the Navrongo Health Research Center and the War Memorial Hospital, then to Dodowa Health Research Center as director until your retirement in May 2023. You hold a postgraduate diploma in genitourinary medicine and venereology with distinction from the University of Liverpool, United Kingdom, and a Master of Public Health and Doctor of Philosophy in Infectious and Tropical Disease Epidemiology from the University of Western Cape, South Africa. Your many awards include Outstanding Member of Staff, Sunyani Regional Hospital in 1996, Best Senior Research Scientist at the Navrongo Health Research Center in 2016, Special Commendation Award by the Ghana Medical Association in 2009, the Ghana Medical Association Long Service Award in 2015. You served in various roles on many research studies during your time at the Navrongo Health Research Center and have more than 70 articles in peer-reviewed journals to your credit. You're an adjunct professor at the Georgetown University School of Nursing and Health Studies and have served as an executive committee member without portfolio at the Brong Ahafo division of the Ghana Medical Association and a planning committee member, secretary of the scientific subcommittee for the planning committee of the Ghana Medical Association AGSM held in Sunyani in 1998. He also served as the chairman of the Upper East Division for 12 years and are fondly remembered and referred to as Mugabe. He also served as a member of the Constitutional and Legal Affairs Committee for almost 10 years. You have served this nation for almost 35 uninterrupted years in various medical capacities until your retirement. Dr. John E.O. Williams, in recognition of your services to the nation and the association, Council this day confers on you its highest honor of Fellow of the Ghana Medical Association. Accept this honor, and with it, all its rights, privileges, and responsibilities. Would like to call Nana Kobna Nketia V to please present this award. Next, I'd like to call Dr. Jikwa Planjru. The applause says a lot. For a lot of us, she's teacher and mother, all in one. Citation in honor of Dr. Jikwa Planjru. Your name is synonymous with excellent newborn health care in Ghana. You were born on Valentine's Day in 1961 in Kumasi and attended the Wesley Girls High School in Cape Coast, where you completed your ordinary and advanced level certificates before obtaining the Bachelor of Medicine and Bachelor of Surgery in 1985 from the Kwame Nkrumah University of Science and Technology, Kumasi. Since then, you have also obtained a membership in the West African College of Physicians in 1998, Fellowship in the Ghana College of Physicians 2005, Diploma Project Design and Management in 2007, Bachelor of Law 2009, and were called to the Ghana Bar in 2012. You passionately pursue the attainment of excellence in newborn healthcare across the country. You have 31 peer-reviewed publications on various topics to your credit, mostly centered on newborn care, breastfeeding, legal and ethical issues in medicine, and dysmorphology, with emphasis on cleft lip and palate care. You also have over 50 social, medical, legal, and child health-related articles published in various media, including a poem on kangaroo mother care read at an international meeting in Pretoria, South Africa. You have also offered technical support to the following documents: the Medical and Dental Council document on fitness to practice 2013, Medical Students Charter for the School of Medical Sciences, KNUST in 2014, the Medical Tree Glossary in 2015, and the National Kangaroo Mother Care Guidelines and Training Manuals, the UNICEF Child Protection Guidelines for Health Workers in 2018, and the UNICEF Child Protection Training Manual for Health Workers in 2018. You have facilitated many Ghana Medical Association continuous professional development activities over the past 2 decades. This involved you traveling across the length and breadth of the country to bring the CPDs to the doorsteps of colleagues. Your awards include the Konfanochi Teaching Hospital Overall Best Worker in 1994 and again in 2013. The Christian Medical and Dental Society Citation for Services to Society in 2015. The People's Choice Practitioners Excellence Awards for the Most Versatile Clinician of the Year in 2017. The Pediatric Society of Ghana 2018 Citation for Leadership Services to the Society. Ghana Health Service National Awards for contributions to improving newborn care in Ghana in 2018. And the Hilltop School Award for Services from 2006 to 2019. In your own words, I consider helping a struggling mother to successfully breastfeed her baby as one of the most valuable uses of my time as a neonatal pediatrician. Dr. Jekua Planjuru, in recognition of your services to the nation and the association, Council this day confers on you its highest honor of the Fellow of the Ghana Medical Association. Accept this honor, and with it, all its rights, privileges, and responsibilities. Thank you very much. And now, would like to call Dr. Isaac Charles Noble Morrison. Citation in honor of Dr. Isaac Charles Noble Morrison. Dr. Morrison, you were born at Enyandenshira in the central region of Ghana on the 17th of September, 1953, and began your educational journey at Kotokraba in Cape Coast, continuing at the Kanishim Methodist School and ending at the Tema Agri Road School, both in the Greater Accra region. You entered the Tema Secondary School in 1967, where you obtained your ordinary level certificate in 1972, and your advanced level certificate in 1974. In September 1974, you successfully completed your FUE before leaving for the Union of Soviet Socialist Republics, USSR, on government scholarship to complete your medical education at Lviv State Medical Institute in Russia. You were involved in student politics, rising through the ranks to become the NUC's vice president in USSR in 1980. After your housemanship, you were posted to the Kolebu Teaching Hospital as a medical officer at the Department of Medicine in 1983. You also worked at the Tema General Hospital, Tema Polyclinic, and Koforidua Central Hospital. While with the Central Hospital, you conducted weekly pro bono satellite clinics at Uhunya, Asesewa, and other surrounding towns. You served as the medical superintendent at the Billington Bogoso Gold Mines Hospital, with oversight over the Bogoso Health Center. You moved into full-time private practice, starting at the Holy Trinity Medical Center in 2002, Nabita Hospital as Deputy Director in charge of health insurance in 2004, and ended at the Nyaho Medical Center as the Medical Director. Since then, you have set up your own facility and other facilities in partnership with others. Notable among them are the Shalom Medical Center, the Prima Health Center, now Dampon Clinic, Fidelity Healthcare in Cinco, Liberia, and Ames Hospital, where you currently work as the medical director. You are past president of the Society of Private Medical and Dental Practitioners Ghana and served on the GMA Council with distinction during your tenure. You also represent the GMA on the NHIS board and play a critical role in the GMA, NHIS, and legal committees. You are fondly referred to as Uncle Morrison by many in the GMA family. You relate very well with junior colleagues. Your eagerness in getting to work on drafting various legal and policy documents for the association is admirable. Dr. Isaac Charles Noble Morrison, in recognition of your services to the nation and the association, Council this day confers on you its highest honor of Fellow of the Ghana Medical Association. Accept this honor, and with it, all its rights, privileges, and responsibilities. Thank you very much. Nana, thank you once again. Thank you, Mr. President.
Thank you so much, Dr. Najama. We are almost at the end of the ceremony, so we'll call on Dr. Felicia Amihir to give us the vote of thanks. Shall we receive her with a clap?
Good afternoon. I'm privileged to be giving the vote of thanks for this special occasion. Well, first of all, thank our Heavenly Father for making this day a success, to see the 65th annual general conference for the Ghana Medical Association. We also want to thank our keynote speaker, Nana Kobina Nketia the Fifth, the Omahen of Escado traditional area, for gracing this occasion. We also want to thank our special guest of honor, Honorable Abena Osei Asare. She is the Deputy Minister of Finance and also the MP for Etiwa East. We are grateful. We say thank you. And we've taken note of all the 1 minute, 1 promise. We also want to thank the Minister of the Land, the Western Regional Minister, Honorable Kwabena Ochiridako. We say thank you. We want to thank the President's Special Advisor on Health, Dr. Insia Asari. our papa, we say thank you. Then the CEO of NHIA, Dr. Okoboy, we are also grateful for your presence in this August occasion. We want to thank the Deputy Director of Public Health, Dr. Gifty Amugi, who is representing the Regional Health Directorate for Western Region. Thank you, Dr. Amugi. We also want to thank all the traditional leaders and all the religious leaders here. We are grateful. Thank you all for gracing this occasion. And not forgetting the rest from the various pharmaceutical industries. We work together. We also thank you, and then we appreciate the collaboration and also the sponsorship. We also thank all our sponsors for making this program a success. The chairman of the GMA, Dr. Frank Srebo, we say thank you very much. So you see, yes, the president, our president has said it all in his speech. So I think GMA, our president has fully represented us. So we are grateful. The chairman of GMA, Western Regional Division, Dr. David Owusu, and then the local organizing committee. The local organizing committee, if you are here, you can give us a wave, because the Western Regional Local Organizing Committee, you have really done well. You see, thank you very much. We also want to acknowledge everyone present here, and also those online. You can give us a wave. We are really enjoying your participation. And then those of us in present, all the GMA members present, and every other person present, we say thank you. Tomorrow, now they don't close. So when you hear the FM stations, especially TV3, and all saying good morning, then it is GMA Western Division saying that thank you very much. We are grateful. Thank you.
Thank you. Thank you, Dr. Amihia. Today I have a few lashes to receive. Just before this should have been a quick word of appreciation from the awardees. So when you pray for me. This evening I'll take a few lashes. So I'll call my own mother and mother, Dr. Jikwa Planchuru, to give just a few words on behalf of all awardees. Shall we give her a quick clap? Yes.
Distinguished members of the high table, distinguished colleagues, ladies and gentlemen, indeed, I'd like to say on behalf of all the awardees to say a very big thank you. We are honored, we are humbled, we are very grateful. If I look at the list of people who have been fellows of GMA, I'm not sure that I belong there, but we are truly grateful, and we promise, I believe I can say on behalf of all of us, that we believe with the help of God that we will live up to the expectations and the responsibilities that are expected of us. So thank you very much.
Thank you so much. One thing you notice is that all our fellows, if you ever meet them, very humble and noble in all their achievements. Thank you once again. Before we take the closing prayer, just a few quick announcements. Please, after the closing prayer, we'll wait for the high table to depart, and we'll have the official opening of the exhibition. And then from there, we'll all proceed to the forecourt of the reception, where we'll have the group photographs. The order of photography will be announced there. When we close this session in the afternoon for all GMA members, we'll have the fund AGM this afternoon after lunch. This evening, the regional minister is hosting us. He has promised a showdown this evening at his residence. And so we'll meet there for the evening cocktail. So thank you so much. And
yes, we call on Apostle Echo Ansa Agri, founder of Fountain of Grace Royal Chapel, to give us the closing prayer.
please be upstanding. We've sat for a while. Shall we close our eyes? Father, we thank you in the name of Jesus. We began with you. We are ending with you. Thank you for bringing us to a successful end of today's program. We thank you for gracing us with your presence. We commit tomorrow's event unto your hands. We ask that, Lord, all will go as planned. And when everything is said and done, you'll carry everyone safely to his or her destination. We say glory be unto your holy name. Thank you for life. Thank you for good health. Thank you for preserving us. In Jesus' mighty name we pray. Amen.
Thank you. Thank you so much, everybody, for making the time and staying engaged throughout the program. We want to say a special thank you to Secretary Jones. Yes. And God bless us all.